Good morning, good afternoon, and good evening, everyone, wherever in the world you may be joining us from today. My name is Francesco Del Carpio, and I am the CFAL York Operations Coordinator. I would like to officially open the fifth session of the Nurses' Voices speaker series. Today's session focuses on nurses' voices from Southeast Asia. The series is being presented in partnership with the Nightingale Initiative for Global Health. I would like to begin today's session with a land acknowledgement. We acknowledge and recognize that many Indigenous nations have long-standing relationships with the territory upon which our campuses are located that precede the establishment of York University. The area is known as Toronto and has been caretaken by the Anishinaabe Nation, the Haudenosaunee Confederacy, and the Huron-Wendat. It is now home to many First Nation, Inuit, and Métis communities. We acknowledge the current treaty holders, the Mississaugas of the Credit First Nation. The territory is subject to the Dish with One Spoon Wampum Belt Covenant, an agreement to peaceably share and care for the Great Lakes region. As this is an online event, our participants may be joining from various locations, so I strongly encourage you to learn about the traditional land upon which you are located. With this, I welcome our moderator, our speakers, and our participants from around the world. Welcome to our webinar. Without further ado, it is my great pleasure to introduce our moderator, Dr. Phalakshi Manjrekar, who is the Distinguished Nursing Director and member of the Board of Managers and Trustees at the PD Hinduja National Hospital and Medical Research Center. For the sake of time, Dr. Manjrekar's full bio and the bios of all of today's speakers will be posted in the chat. Dr. Manjrekar, thank you very much for moderating today's session and for all of your work in helping put this session together. The floor is yours.
Thank you, Francisca. A very good evening, a very good morning to all of you. It's a pleasure to lead this session today. The voices of Southeast Asian nurses, they are so important. They form a forum where over a period of time, we can proudly say we are getting better and we are reaching there. And that's something which no one else would be able to voice out. At the outset, and Nightingale University Sapal on the forum of UNITAR, we wouldn't have been able to reach out to millions of nurses without this partnership. We really want to take this opportunity to thank you and wish for many more such partnerships. I would also like to make this forum a session, an example for many others to follow. The voices of nurses need to be heard. The voices of their leaders are the voices of our nurses. We are extremely fortunate today to have representations of multiple countries. We have national presidents of nursing associations who would be using this forum to highlight the activities, advancement, the professional capacities of their own nurses. We have academicians, we have nurse leaders, we have professors from renowned institutes who would be using this forum to highlight institutes and their benefits on how they would be able to take this entire forum. What can we really say without the students? Student nurses of today are nurse leaders of tomorrow. They form the pillars of nursing institutions. We are extremely glad that we have been able to take them into this forum to be the voice of tomorrow. Nursing today is a profession which needs to be understood, which needs to be looked forward to. Healthcare scenario is changing, and how changing? It's rapidly changing. If as I'm not able to keep up what's happening in my healthcare forum, I would really not be able to get today. Patient outcomes, understanding of evidence-based nursing, understanding of quality initiative is the backbone, is the principal goal of a nurse of today. What we also need to understand is that academics, nursing training, and education is where it all began. Fortunately for us, or unfortunately for us, we started with a forum which was just a non-degree or a diploma forum. However, in many of the developing countries today, we are not able to get rid of it. It still continues alongside with a university degree program. But does that allow the nurses not to reach a pinnacle of the top of the mountain? The answer is no. Today's nurse has reached the highest pinnacle. She has that would be able to stand shoulder to shoulder with any nurse in a global forum today. Today, we have nurses who have joined in from various parts or many countries around the world. and they are an example of nurses today. On Nursing Forum, we really are able to say unitedly that yes, nurses come together on a global forum and have a sisterly advocacy to allow us to go ahead. And that's what we look forward. Today, we say doing much better today. The future nursing leaders is ours, and that's how we want to see. Helping individuals to develop their abilities is what is the goal of our nurses. Today we have a fortune called Ahmad, who helps individuals on wheelchairs to go into a dance forum. And that's just one way of creating creativity in abilities. How do we wish that that's something which everyone would want to, take forward? I welcome today's participants, panelists, speakers, esteemed leaders to understand, reciprocate the nurse's voice of today and tomorrow. Let's begin this session with a small video of the drum, which we would want to make an example of what we want nurses as of tomorrow. Thank you. Could we have the video, please?
आजा आजा जिंदे शामी आने के तले आजा जरी वाले नीले आसमाने के तले जय हो जय हो आजा आजा जिंदे शामी आने के तले आजा जरी वाले नीले आसमाने के तले जय हो जय हो जय हो
Thank you. And how wonderful was that? And that's what we really want. How do we really want to, look at our people? We want them to look at us saying that, yes, thank you. You have been able to help us to go to the next step. Let's start today's session with our keynote address. Dr. Deepika Cecil Khakha. She's the nursing advisor to our health ministry. Many of us would definitely, come together and say, the health ministry is the forum of decision making. We may have fabulous ideas, we may have advanced inputs, but unless and until we have our government of our own country standing next to us, helping us to create a process, helping us to create a protocol, our ideas would not really materialize into action. Dr. Deepika, if you look at her bio in our chat section, is an extremely acclaimed nurse leader. We are extremely happy and thankful that she has been able to spare her time and share with us what she was able to proclaim and process with respect to her own country, India. Thank you, Dr. Deepika, for joining us. The floor is yours.
Thank you, Phalakshi, for those kind words. Greetings from Directorate General of Health Services, Ministry of Health and Family Welfare, Government of India. Good morning, good afternoon, good evening. At the onset, I would like to thank the organizers of Nurses Voice series for giving me this opportunity. And today marks a significant day that I'm deeply honored to address you, especially as a keynote address for Southeast Asia region. I am the nursing advisor, as mentioned, at the Ministry of Health and Family Welfare, and this is the senior most position of nursing in the country. And I'm actively involved in healthcare policy making and decisions and discussions related to nursing research, nursing education, and nursing practice and service. In my current role as an advisor to the government, I collaborate with the senior government officials and healthcare administrators to translate the policy recommendation into actionable initiatives. My background, I'm a student of RAK College of Nursing. I'm a graduate and postgraduate of this very first college of nursing in the country, which has a rich legacy of producing national and international nursing leaders. I have also a postgraduate degree in psychiatric nursing and psychology. And the reason why I picked up nursing as my career was my mother, who was my role model. My mother was also a nurse, and her distinct traits of being a very committed, dedicated, and compassionate person, gave me the reason why I'm a nurse today. I have 35 years, more than 35 years of work experience. I have worked in different capacities. My predominantly work experience has been for 34 years at an apex institute of the country, which is called the All India Institute of Medical Sciences, New Delhi. I have worked in different capacity. I started my journey as a bedside nurse. I did bedside nursing for more than 13 years, and thereafter I became a counselor, and I counsel patients with HIV and AIDS. And for the last 18 years, I was an academician. I was teaching at the College of Nursing, which had graduate, postgraduate, and PhD program. I've currently I am working for the last 1.5 years as a nursing advisor to the government. And the government of India has undertaken several initiatives to improve the nursing sector and enhance quality of nursing care. Some of the very significant initiative is the establishment of National Health Mission, which is called NHM, which the reason for having NHM is it aims to strengthen the healthcare delivery in the country, including nursing services, and it focuses on improving access to quality healthcare, especially in the rural and the underserved areas. Now, as you know, India is a very vast country with diversity, cultural and ethical diversity, and the government has initiated many programs to attract more individuals to nursing profession, including financial incentives and scholarships. The program aims to encourage young people to pursue nursing as their career so that we can address the shortage of nursing staff in the rural and remote areas. The government also provides incentives for nurses to work in the government healthcare facilities, ensuring that these facilities have adequate number of nursing staff. However, there is promotion of interprofessional collaboration and teamwork in the healthcare settings, and it recognizes the effectiveness of effective teamwork between nursing, doctors, and other healthcare professionals, which is essential in providing comprehensive, holistic, and quality care to our patients. The government of India has recognized the vital role the nursing plays in the healthcare delivery system, taking significant initiatives to strengthen the nursing sector and improve the healthcare services in the country. And especially coming of COVID has been an eye-opener to the governments all across the world. They have understood the importance of investing in nursing, and when one invests in nursing, it always gives to very promising outcomes. So the initiatives to aim to enhance the nursing skills, improve their working conditions, and promote research and innovation in nursing has been very monumental in making a lot of difference in the nursing scenario in our country. So by addressing the shortages of skilled nurses and enhancing the quality of healthcare services, the government has committed in achieving the goal of providing accessible and affordable healthcare to all the citizens. The initiatives that have been focused on improving the technical skills of nurses, but also to enhance the importance of imbibing compassion, empathy, and effective communication in the patient care has also been a very important agenda for the government to inculcate these values in the nurses through having a very quality nursing education. And especially recently we had a competency based curriculum in 2020, which was a very robust curriculum of nursing which meets all the international standards, which was rolled out by the Indian Nursing Council, which is a regulatory body of nursing education in our country. There have been challenges, and the government has taken certain initiatives and has a significant impact on the profession. There have been new cadres created like community health nursing officer. This was a flagship program of a national program called Ayushman Bharat, in which the initiative by the government was to the basic aim was to improve the primary healthcare services in the rural areas, with the focus on bringing quality medical services to remote corners of the country. And this community health officers play a crucial role in bridging the healthcare gaps. These are mid-level care providers, which are predominantly nurses, and their primary responsibilities including diagnosis, treatment of common ailments, providing essential preventive care, educating the community regarding maintaining good lifestyle practices. Also, they are able to link up with the experts through telehealth, and they are able to give uh, the, the prescription and the consultation to people who don't have access to specialized care in remote and underserved areas. These community health officers also conduct regular health assessments, identify risk factors, provide appropriate treatment and referrals, and they play a very important and essential role in promoting awareness about immunization, family planning, and healthcare interventions. Another very landmark and flagship program of the government of India was a midwifery initiative. Now, understanding and realizing that maternal and child health are very important healthcare indicators, the government of India had rolled out this midwifery initiative in 2018, and the focus was on providing quality care and support to expecting mothers, right from the spectrum of care started right from preconception to antenatal period, childbirth, and postnatal period. And the initiative aims to bridge the gap between the traditional and modern healthcare practices. This midwifery initiative plays a very crucial role in ensuring the health and well-being of mothers and newborns. And midwives are trained professionals who specialized in the providing holistic care during pregnancy, childbirth, and postpartum period, and they are trained as per the ICM competency and standards. And they possess the necessary medical knowledge, skills, competencies to provide respectful, emotional, compassionate care to the mother and child. And they have proven, evidence proves and suggests and shows that there has been a significant reduction in the maternal and infant morbidity and mortality with the coming of this new cadre of nurse practitioner midwives, as these midwives are able to identify and manage the complications during pregnancy, childbirth, and prevent potential risks and ensure safe delivery. These midwives also provide essential education to support the mothers and empower them to make informed decisions about their own health and the health of their babies. In India, accessing quality healthcare is a challenge, and midwives play a very pivotal role in, in the health of the women and children. And many women in the rural areas and remote areas do not have access to doctors and hospitals. Thereby, midwives play a very phenomenal role in making a difference in the health of the mother and child. By promoting midwifery, the government of India aims to improve the maternal and the child health outcomes and reduce the disparity in the healthcare access across the country. Another very phenomenal initiative which was taken by our government is our government has realized that investing in nursing always gives very promising and it makes a phenomenal difference in the healthcare delivery system. Recently, our government had declared and started working on establishing 157 new nursing colleges to be co-located with medical colleges to improve and strengthen the nursing education in the country to meet the healthcare demands of the population. The government has taken an initiative to establish these new nursing colleges by understanding that it is very imperative to have well-trained nursing workforce, which is essential in the delivery of quality healthcare services in the country. And by increasing the number of colleges, currently we are having more than 5,000 colleges. We have programs of ANM, which is Auxiliary Nurse and Midwife, which is a 2 years diploma program. We have another program called GNM, which is General Nursing and Midwife, which is a 3 years program, which is a diploma program. Then we have a baccalaureate program, which is BSc Nursing, which is a 4-year program. We have a post-basic program, which is an equivalence from a diploma nurse to become a graduate nurse, which has to do 2 years of educational qualification. Then we have a master's program, which is a 2 years program. We currently have running 2 nurse practitioner program, which is nurse practitioner critical care, which is a 2 years residency program, as well as this program, which I was mentioning at the midwifery initiative, which has nurse practitioner midwife. We have certain more nurse practitioner programs in the pipeline. And this is also an initiative and a proactive measure by the government of giving autonomy and prescriptive powers to the nurses by rolling out the nurse practitioner programs. So the government has allocated substantial amount of funds for establishment of these new 157 nursing colleges, and it includes investment in form of infrastructure, equipment, faculty recruitment, and curriculum development. So the government is committed in creating environment which is conducive for learning and skill development. Furthermore, there are certain scholarships and financial assistance given to encourage the students to pursue their nursing education, and these initiatives aim to make nursing education more accessible and affordable for aspiring students, especially from economically disadvantaged backgrounds. Another initiative and a phenomenal change has been brought into the regulatory system of our country. We have a new National Nursing and Midwifery Act, which has come into being in 2023. And the bill provides for the regulation and maintenance of standards of nursing education and service for nursing and midwifery professionals. It introduces several crucial provisions to elevate the standards of nursing education and services and enhances the professional conduct, greater transparency, and accountability. The National Nursing and Midwifery Commission is an act to provide regulation and maintenance of standards of education and services by nursing and midwifery professionals, assessment of institutions, maintenance of national register and state registers, and creation of system to improve access and research and development and adoption of the latest scientific advancements for the matters connected therewith or incidental thereto. Emphasizing the importance of engaging in collaborative brainstorming sessions on subject of nursing reforms, there have been certain schemes and initiatives by the government which focus on paving a way for transformative shift in the nursing sector by enabling the healthcare providers to deliver quality patient care so that they can contribute to shape the future of nursing reforms in India. There have been certain schemes like upgradation of School of Nursing to College of Nursing, and funds have been allocated by the government to upgrade the School of Nursing to College of Nursing. Then, in order for doing capacity building for the nurses, the funds have been allocated by the government to support the nurses and do on-job training to improve their competencies and skills and to meet the changing needs and the changing scenario of the diversified and healthcare needs. As we know, change is the only constant in our lives, and the healthcare needs and the healthcare trends are changing. So it is very imperative for us to be abreast with the changes. Thereby, the funds have been allocated by the government for capacity building of the healthcare and the nursing healthcare force so that they are competent to meet the needs of the changing healthcare scenario. Another initiative by the government is to facilitate and kind of acknowledge the contribution, the relentless efforts of the nurses in their delivery of healthcare, and especially felicitating the nurses who have done exemplary contribution to make a difference in the health of and healthcare facility wherever they're working. The government has a award called Florence Nightingale Award, which is mostly given on Nurses Day. That is on the birthday of Florence Nightingale, and the President of India, who's the highest post or the highest office, the highest office of a country, the President of India gives away these awards at the President House, which is very commendable and a mark of respect for the nurses and their services, which are given by the highest office of our country. The way forward is that the vision encompasses trained, educated, empowered nursing workforce in India, which is leveraging the cutting edge of technology such as electronic health records and telemedicine. Nurses will be given authority to lead the healthcare settings and policy making so that they can help to shape the healthcare policies, and profession will be distinguished by research and innovations. Another important thing which we can do in platforms like this is experience sharing of the leaders for the best practices and indicators to promote and retain a nursing workforce in the respective countries. We know there are challenges of shortage of nurses. There are challenges like we don't have, if there is attrition, the challenges of migration of nurses from the country of their origin to greener pastures. So we have to also see and proactively think of the strategies how we can retain our nurses in our own countries of origin so that they're able to deliver the services that are expected out of them. Another important way forward is that we can collaborate with ICN for development and mentorship of nursing leadership for effective decision making and policies pertaining to nursing education, nursing research, and nursing services. I would like to conclude by saying that you must be aware of how every detail of these different aspects aligns with the policy priorities and the strategic directions of 21 to 25, which has 4 policy priorities, that is education, jobs, service delivery, and leadership. The Indian government has also made an initiative for nursing leadership. We have central level nursing leadership and we have state directorates also in some states and the central directorate, which is basically handling the nursing leadership in the country. So Indian government has implemented significant nursing initiatives to improve the healthcare services, which would foster in achieving the universal health coverage and the SDG goals. They include quality education, research and innovations, and aiming to attract and retain talented nurses. The government also aims to integrate the technology into nursing practice, such as electronic health records, telemedicine to enhance patient outcomes, and to see to it that they're significantly shaped for the better and a brighter future in India. Moving forward, the government is determined to continue investing in nursing and recognizing the importance nursing plays in the delivery of healthcare system in India. And I would like to wrap up by saying, and I quote the a modern icon of modern nursing, which is Florence Nightingale, that I quote, "I attribute my success to this. I never gave or took an excuse," unquote. This is for all of us attending here and all the nurses all across the world. Once we have this mindset that I will never give or take any excuse, we become unstoppable. Challenges are there, but we have that extra energy to combat those challenges and come out as a victor. And I'm very sure once we have that mindset, and it is also our responsibility as leaders to mentor our juniors and always inculcate into them that everybody working in any capacity, anywhere in the world, every nurse working in any healthcare capacity, in any healthcare scenario is a leader. And once you have that mindset that what difference am I going to make to the system and what contribution I'm going to make, that is going to be a big game changer, and that is our own contribution to nation building and to the global health. With this, I again like to thank the organizers for giving me this opportunity and to speak on the behalf of my country. Thank you so much.
Thank you very much, Dr. Deepika, Cecil, Khakha. You have impressed all of us here, I'm sure. And that's what we want to see. We want to see our nurse leaders stand up for nurses and be proudly taking forward the initiatives for what we want to see in the nurses of future. Thank you for doing that. Thank you.
Thank you for the opportunity.
To continue, we have our next speaker, Dr. Ramesh Venkatesa Perumal. Dr. Ramesh has been an assistant professor of the host university, York University, but primarily he has a side to him, which is Indian. He is basically a nursing professor who has seen the sides, both the sides, if I may say so. He knows what is the Indian scenario. Today, he knows what is the scenario in Canada. We are looking at academic advancement of nurses having a global viewpoint of multiple countries to ensure what we can adopt and how we want to perform. The floor is yours, Dr. Ramesh, and we are very eager to see what you can share with us.
Thank you, Dr. Manjrekar. Thank you for that wonderful introduction. Good morning, good afternoon, and good evening to everyone. Ramadan Kareem to all those who are observing the holy month. It's a pleasure to be here and to bring you greetings on behalf of York University, particularly the School of Nursing. Thank you, everyone, for being here and for inviting me to participate in this beautiful initiative. I want to thank Dr. Mariyam, International Co-Director of Nightingale Initiative on Global Health, Dr. Phalakshi Manjrekar, Board of Directors NIGH, Dr. Ali Asghari, Director, CIFAL York, and Francisco Del Carpio, CIFAL York Operations Coordinator, for organizing such a wonderful Nurses' Voice series. Thank you to all the distinguished panelists. And my name is Ramesh. I'm an internationally educated nurse from India. I've been in Canada for the past 9 years, and it's been quite a journey. I'm currently the coordinator for the Internationally Educated Nurses program at York University, and I'm also the undergraduate program director for the four-year direct entry BScN program at the School of Nursing at York University. I started my career as a student in the diploma program in nursing in India. I spent several years studying and working in a tertiary care hospital in the southern part of India. My alma mater taught me to always not to be served unto, but to serve. After a few years, I moved to one of the most beautiful Middle Eastern countries named Oman, where I had the opportunity to work with and learn from several scholars. I was part of the leadership team that established an undergraduate program in nursing, and now the graduates are doing an amazing job in the country and across the globe. I want to start with a small story. This is a story of a nurse on one of her night shifts. This was at 3 a.m. One of the patients had fever, and those days giving cold sponging to patients with fever was a practice. This nurse also started sponging this patient. As she started sponging, tears were rolling down her eyes, and the patient noticed this and asked, "Sister, why are you crying?" Please note, this is a common practice to call nurses as sisters and brothers. And still there are a lot of places where patients call nurses as sisters and brothers, right? The nurse said nothing and continued sponging, but the patient insisted. The nurse said, "I'm a single mom with a 6-year-old daughter. When I left for work last night at 9 p.m., my daughter had fever. I gave her a dose of medication and left her with my aged mom. It's 3 a.m. now, and she's due for the next dose of medicine. I'm not sure if my mom would be awake to give her that medication." On listening to that story, the patient was moved and was in tears. As nurses, we can all relate to this story. As we leave our loved ones to look after those whom we don't know, whether it rains or shines, we look after our patients. I want to thank all the nurses across the globe for the marvelous work you do and the selfless service you provide to people. I want you to pay attention to the image that is shared, and this image is quite familiar to all of us. We can easily recognize the lady with the lamp, who is the pioneer of modern nursing. I wish to consider each of us as the miniature of the lady with the lamp. Wherever we are, whether at the bedside, whether in education or in research, we stand with the lamp illuminating our surroundings. I'm not talking about standing on a higher pedestal, but with humility, we shine the light around our patients so that our healthcare team members can see better and provide the care needed for our patients. This is a mandate that people have given us across the globe by voting as the most trusted profession. I want to focus on nurses' unique role in healthcare. Nurses from Southeast Asia have been doing phenomenal work in healthcare. We nurses are privileged, and the privilege comes from knowing the context in which we are working. Mostly healthcare institutions understand the issues of the patient, the context in which we are working, right? This knowledge helps us to facilitate self-determination among our patients. Now, for us to do this, we must be determined to focus on the role of advocacy. Now, advocacy is a concept with different meanings. It could be as basic as providing information to those patients for better decision-making and upholding the self-determination or autonomy among patients. Advocacy could also mean developing programs by a group of professionals for better quality care. Or as ICN describes, it could be advocacy for a safe and healthy work environment. It's a common theme across the globe, particularly in the codes of ethics of nurses. Now, nurses are resilient, quick learners, and advocates for their patients even when they face personal adversaries. In the Southeast Asia and across the globe, nurses are in a unique position as they have insights into human experiences, unlike other professionals. Nurses advocate for their patients at every level. Nurses should utilize a nursing lens to advocate for policies at the national and global level. The role of a nursing leader is critical to nursing advocacy. And I was very, very happy to hear Dr. Khakha speak about the role that she's playing, the influence she has on the policy making in India. I know the challenges you're facing, Dr. Khakha, and you're yet making significant contribution. All nurses are looking up to you as a great role model. And I also want to thank the other co-panelists who are great nursing leaders who role model advocacy in all aspects of their professional lives. It's important to recognize the need for formal education and prepare nurse leaders for advocacy. Is our curriculum geared towards preparing nurses for this role? I'm happy to state that the nursing curriculum at York University is embedded with the principles of social justice and advocacy, like many other nursing programs that advocate for equity in access to healthcare. Our graduates, I can proudly say, will be significant influences of equity and social justice, and will impact many lives as they graduate and move into the profession. Various nursing professional organizations have also been advocating for equitable resources globally during the pandemic. And we have seen their significant work during the pandemic, whether it was International Council of Nurses, whether it is national organizations, or whether local nursing organizations. However, the professional organization's role and mandate have to be explored further. They have a lot more to offer. As an advocate of equity, I wish to draw the attention of all nurses to a more significant calling and commitment. I refer to the call to play an active role in achieving sustainable developmental goals put forward by the United Nations in 2015. That's the bigger calling that we have, all nurses. 193 countries came together and developed 17 goals with a vision to end poverty, protect the planet, and improve the lives and prospects of everyone and everywhere by 2030. I'm happy to hear that India has included SDG in all their programs. Congratulations, Dr. Khakha. Nurses have the advantage of reaching the majority of the population through their service, which makes nursing well positioned to influence the achievement of these goals. The question is, are we prepared to address this challenge? Are we preparing the future nurses to focus on these goals? In general, there is a lack of awareness among nurses about the SDG. The question is, how do we prepare nurses to advocate for SDGs? One of the ways to move forward would be interprofessional education. And I wish the academicians would take note of this. Preparing nurses to be global citizens. We are moving without borders. And this is one example where nurses' voice. An increasing representation of nurses at all policy-making levels have proven effective. And one example is Dr. Khakha being present at the policy-making table. We must also recognize significant barriers nurses face, including lack of time, resources, and skill set. All healthcare organizations must recognize the need to invest in nursing and trust nurses' ability to make a difference. I appeal to all nurses to recognize that it might start with one individual and progress into a collective activism. By sheer numbers and the unique position, we nurses can make a difference in the health of our population. We must also recognize that the oil in our lamp may be depleting. Self-care is not selfish. Often self-care improves resilience and efficiency. It is essential to recognize the need for self-care. In the words of Florence Nightingale, so never lose an opportunity of urging a practical beginning, however small, for it is wonderful how often in such matters the mustard seed germinates and roots itself. End of quote. It's important to act. And I want to conclude that action is important and leave you with this thought. I was homeless, and you preached to me the spiritual shelter of the love of God. I was lonely. You left me alone to pray for me. You seem so holy, so close to God, but I'm still hungry and lonely and cold. Thank you, everyone.
Thank you, Dr. Ramesh. That was wonderful. I think we all really appreciate the fact that you have been able to focus on self-care. And that's what the nurses need to look forward today. How do we want to go ahead is what we can do and take a decision for ourselves. Extremely important. And thank you for the share.
Thank you.
As we move on, we have the president of another country who will represent his own country in his own way and let us know what have been the policies and challenges of his. From Bangladesh, we have Mr. Maynul Hassan, who represents his own country in his own way and is able to let us know what is that in this country that we would want to know more. Thank you. You're welcome, Mr. Maynul Hassan. We look forward to see you and listen to your share. Okay. Yeah.
Good evening, good morning, and happy Ramadan to you all. Is the sound is okay?
Yeah, we can hear you.
Okay. Thank you very much, dear coordinator, and all the amazing organizers. So I am Maynul Hassan. Basically, I am a nursing officer, and my placement is in the Shahid Suhrawardi Medical College Hospital under the Ministry of Health and Family Welfare, Bangladesh. Currently, I am attached to Bangabandhu Sheikh Mujib Medical University for pursuing my master's in ophthalmic nursing degree. So actually, I am a pure student now. After graduating, I worked as a senior staff nurse in Aisha Memorial Hospital, and after then I joined to ICDDRB, that is the International Center for Diarrheal Disease Research, Bangladesh. I worked there as a research assistant in a randomized control trial project for cholera patients. And then in 2016, I have joined the government service. And also, I am teaching in a nursing institute, that is the Mohammadpur Model Nursing Institute. And I also working as a International Affairs Secretary for Bangladesh Nurses Association. So I would like to thank all the sponsors of this amazing program. It's really very amazing and actually great experience for us to be connected with these great leaders from around the world. And it is especially very interesting for the Southeast Asia nursing leaders, because the India and Nepal, those are very close neighboring country to Bangladesh. And I also love to thank our Honorable President, Mr. Khan Muhammad Ghulam Murshid, for his full dedication for our nurses. I want to say that he is actually working 20 hours a day and 365 days in a year for the betterment and development of nursing profession in Bangladesh. So the theme of this Nurses Voice series is the concern, compassion, and commitment. So we can say that public health is our great concern, and we are compassionate about our patient and committed to our profession. So to me, the meaning of nursing is standing beside the ill, alleviate human sufferings, promoting public health, and of course, transferring knowledge and skills to next generation, because the next generation is our future leader. So transferring knowledge and skill is very important for us. So what motivates me to become a nurse? So actually, if I say very frankly, like a developing country like Bangladesh, here the employment opportunity is a important point to select a profession. This is very frankly. So employment opportunity was the main point for me to choose the profession, and of course, the helping others. So in this profession, it is really we can help others very closely, and also interest in healthcare, it was another motivation. And actually very interestingly, some Nepalese friends of mine, it was another motivation for me to become a nurse. When I went to my university to join the Bachelor's of Science in Nursing degree, actually in the first day, I found some of my Nepalese friends in my university, and I was astonished to see them that actually they came from Nepal and they are studying Bachelor's of Science in Nursing degree in Bangladesh. So that gave me a very valuable and important message that yes, this may be a very good choice for me, because the international students, they are coming to our country and they are studying the nursing. So it made me motivated to pursue my Bachelor's of Science in Nursing degree. So actually the major challenges in our country, so there are so many challenges for nurses in a country like Bangladesh and in low socioeconomic countries. So in a study conducted in 2019 in Bangladesh, so barriers to quality of work life among Bangladeshi nurses, a qualitative study. So this study found that there are seven barriers in nursing profession. So I want to highlight some among these. Is the de-evaluation of higher degree and absence of promotion. This is a very big concern for the nurses, because in spite of having higher degree, they are not getting their due promotion. This is a very pathetic situation. We have lot of our senior colleagues, teachers who have joined in government sector like 20 years back or 15 years back. They are giving their knowledge, their energy, their time. They are highly educated, and also there are some PhD nurses also in our country. But very unfortunate is they are working as a lecturer. They are not getting their due promotion. This is a very big problem in our country. So absence of promotion, actually there are no career pathway, career ladder in Bangladesh. We have the recruitment rules, 2016 recruitment rules for the nurses, but unfortunately these rules are not being followed. The administration in our country, they are just attaching the nurses in different senior roles with the additional charge or in the current charge, but they are not giving the promotion. So this is a matter of big dissatisfaction and frustration. So this is another point that actually nurses are not getting interest to have higher education, because they are thinking, what will be the result after getting my higher education? So another is heavy workloads and workplace bullying. So in a densely populated country like in Bangladesh, you all know that there are huge burden of patients. So due to out of pocket expenditure, the many of the patients, they are bound to take their treatment in the government hospitals. So in the government hospitals, the patients ratio is very high. For example, if there is 1000 patient bed, but there is 2000 patient, so the nurse are having heavy workloads. And also there are workplace bullying. This workplace bullying is not from the patient side, patient attendants, but also the interprofessional bullying. And there are some obstacles from the administration, because the nurses do not have the administrative power. So in our health systems, the physicians are the administrator everywhere in Bangladesh health sector. So especially this is a very crucial scenario in the very root level, that is the Upojala health complex level. The nurses face so much crisis, the also the workplace bullying. The local political leaders, they come to the Upojala health complex to get their treatment, and what they do, they just try to use their power. They don't understand the situation, they do not try to understand the situation, but they want to utilize their power. So this is a very very difficult situation to handle the situation for the nurses. So what they will do, they will care for the patients or they will handle the bullying. This is a very hard situation. And another one is the apron issue. This is currently this is a very critical issue in nursing sector. Actually, the white coat apron in a Muslim country like Bangladesh, actually the apron, the nurses, and also the female dominant profession like in Bangladesh, the 90% of our colleagues are female. So in a Muslim country like Bangladesh and a female dominant profession, actually nurses use their apron as a protective equipment, and also for the personal, what I can say, protective equipment, and also to protect their privacy. So actually nowadays what is happening, the administration is trying to take up the white apron, and this point is making the nurses very frustrated, because the administration is telling the nurses to wear other color apron. Like actually at this moment our uniform is the olive color uniform. So the administration is telling us to wear olive color apron, but this is a psychological matter, this is a psychological impact for the nurses in Bangladesh to wear olive color apron. Actually white color is very important to use as a apron, because we can easily find out and understand our infection or any infection. So nurses are very frustrated for this point, because they are feeling that somebody is trying to pull their dress from their body. This is very pathetic. And the interprofessional relationship. So actually healthcare, this is a very team approach. We are very much interdependent with each other, we know very well, but due to lack of interprofessional relationship, actually we cannot give our best to the patients also. So this is the very matter. And actually to handle these matters, what I personally do is counseling, and of course the awareness building to overcome these challenges. When I come across with one of my colleagues who are actually facing these challenges, so what I personally do is I counsel them to understand the situation and to handle the situation with knowledge and awareness building among our colleagues. So without awareness building, being a profession where the 90% is our female colleagues, so it is difficult for them to actually raise their voice against the male dominant society. So, and what is the organizational strategy? Of course, our organization, Bangladesh Nurses Association, is also, they are working to build the awareness, and of course the legal solution, because what we believe is that as a member of noble profession, actually we cannot go to the roads and we cannot make any strikes, because then the patients will suffer. That's why we cannot go to the roads. And so we are working to build awareness among the nurses, so that they can fight the odd situations with their intellect and with their knowledge. And also the legal solution, because in the policies there are prescribed prescribed pathways, what one can do and what one cannot do. So our organization is legally helping our colleagues all over the country to fight those odd situations. So another point is actually nurses also need nursing. So how we manage the competing demands through competing demands. Actually managing competing demands through effective communication and actually flexibility. So actually with heavy patient rate, it is really a very burdensome situation. How I manage, actually, with effective communication with my other colleagues, so that they can help me in my difficult situations. And I actually try to stay flexible, because I know anytime there may be hard situations. So I always stay flexible and ready to face the situations. And what I do actually, when I am very much overburdened, so I try to walk alone in the nature. uh, I just try to feel the nature, how the nature is going. And I love to stay with students. So when I go to students and discuss some new knowledges with them, so my mind converts to other issues. So I relieve from those burden situation. And the burnout among the nurses, because as we are in heavy workload, so burnout is a very common phenomenon among the nurses. And in a study conducted in Bangladesh in 2022, it is found that about 54.19% nurse, they felt burnout due to workplace bullying and violence against nurses. So actually burnout is manifested in our colleagues. So how we can find out that our colleagues are in burnout? So actually when they are burned out, their attitude, behavior is just changed. So and they shows frustration during the conversation. So we can, if we can see, we see closely, we can find out the situation. So what we can do that, we can start conversation with our that colleague, to listen to him or her, okay, actively, so that there is a chance of debriefing what is her problem, what is she facing. So if we give some space, so she can express her problems, and he can relieve from the problem. And actually what we try, we try to arrange some tour to new places, periodical tours to new places, so that the nurses can become fresh, feel fresh from the workload. So another thing is that the what is the satisfaction, what is the source of my satisfaction in nursing is that actually I believe that ability to help other people is a great power that do not belongs to everyone. So I feel that if I help someone, those are ill, those are helpless, actually this feel gives me pleasure. When I think like this, the pressure reduces. And actually, I also believe that it's me who choose the profession. Nobody else choose the profession for me. So I choose my profession myself, and I am here. So this is my duty to perform, to care for my patients. And so what is the future? Future of nursing? Of course, although there are hurdles, difficulties, but what we can see is the future of nursing is very promising. Why? Because due to expanded role and a scope of practice, the scope of practice is being expanded. So we know that the life expectancy is increasing, and the number of elder people also increasing. So this scenario, this is also increasing the demand for the geriatric nurses and old care nurses. So this is in another way, this is an opportunity. And of course, the specialized fields are being introduced with the advancement of the technology. So we will need specialized nurses also. So actually, we believe that we are in an international profession. So the chance of migration is also increasing. So a Bangladeshi nurse or a Indian nurse can work in other countries also. So to meet the evolving needs of the global healthcare, nurses will continue to play a central role in shaping the future of global health and advancing the profession as a trusted and respected members of the healthcare team. So as everything is expanding, the demand of nurses are increasing. So nurses will be in the leading position with their knowledge, skill, and expertise, of course. So before going to conclude, what I want to add something is that actually Dr. Perumal's in presentation, it is seen that to prepare nurses as global citizens, it is useful to have uniform curriculum. So we want to say that is there any opportunity for International Council of Nurses to work for a uniform curriculum for the nurses worldwide? If there is any opportunity to make the curriculum uniform, so the nurses of another part of the world can easily move or adapt to the other part of the world. So the international crisis of nurses can be easily managed by the situation. So that's all from my side. Thank you very much for listening me with great patience. Thank you very much, everyone.
Thank you, Mr. Maynul Hassan. Very, very simply, you were pragmatically
Thank you.
able to showcase the nurse's voice of your country. We are also happy to know that alongside, you also gave in a lot of positive inputs and solutions to the problems on the way ahead. Thank you very much. We all echo your sentiments because as you were presenting, I think so, nurses from Southeast Asia were able to relate to what you were saying, because this is a situation which all of us face in one way or the other in our own countries. Thank you for sharing that and wishing all the nurses in your country the best. We welcome our
Thank you.
next.
Most welcome. Thank you very much.
We welcome our next panelist, Dr. Tazeen Saeed Ali. She's an eminent academician, as we just heard a few minutes ago, when her student was able to share what was her input about her. She comes from the globally acclaimed Aga Khan University and currently is the interim dean of this university. We welcome you, Dr. Ali, and we are eager to hear your voices representing your country. Thank you.
Thank you very much. First of all, I really would like to say thanks to all of you that you have invited a nurse from Pakistan. And I'm really glad to see that we have another nurse who's sitting from the another part of the world and also representing over here. And whatever presenters have already highlighted, I think you have clearly said that we all can echo that this is happening in all other countries of Southeast Asia. So I'm Tazeen Saeed Ali, and I am a professor at moment and also interim dean at Aga Khan University School of Nursing. And it's my alma mater. Even though we get so many opportunities from all over the world to go and work, but we stay back to our countries to pay back our alma mater. But this doesn't mean those who are leaving, they are not paying back. They are also paying back, but they are paying back in a different manner. So I'm really happy to share the nursing voices from Pakistan, mainly focusing at the Aga Khan University School of Nursing, Pakistan. We have number of School of Nursing of Aga Khan University It's in Uganda, Kenya, Tanzania, and soon we are going to have in Middle East countries, but I'm referring over here mainly the Pakistan. So exploring nursing practice, some of the points were given, and I was just thinking that what should I be sharing? Then I thought that it's important to share. This is our building. This is our School of Nursing, the entire School of Nursing, our offices. And we have, this is our Rufaidah auditorium. We thought that we should give a name of a nurse who really contributed a lot in Pakistan, in the Muslim world and Muslim countries, especially in Asia. So after Nightingale, the Rufaidah name, Rufaidah Bibi's name is coming up. So, and then that's why we have given the name. You could clearly see that we have male student. He was my student of 4-year BScN program. Then he became my student in master's program. Now he's the faculty of Khakha University, Sonam. We call it Sonam, School of Nursing and Midwifery. And he's also have received a fellowship right now, and soon will be going for the PhD. So this is just to give you the example that this is what we are doing. We are working with our students and ensuring that they play a good role within the Pakistan. These are our bright girls, graduated last year only, and have worked so much for the Pakistan, and have been raising a lot of funds to be able to help all those who are unable to pay their fees or pay their bills and different things, especially if they are hospitalized. So these students have worked really hard. You can see how bright faces they have, and they are really supporting the patients as well as their colleagues and all. Just to show you that our students are having learning from all these simulators, and they cannot really go to hospital until unless they have the clear practice on the simulators, and then they can only go ahead for their clinical practice. So currently we have 700 plus enrolled students, and we have 5 different academic programs. Diploma have already phased out from our Khan University about 11 years back. So, but we do have a lot of nurses who are diploma. So we need to give them post-RN BScN program, so which you call post-diploma program, so which will be phasing out in this year or probably maximum next year. We have a master's program, and our master's program is having 2 parts in it. The one part is a core part, general part, and then the second part is very much dependent what our graduates would like to do. If they would like to become advanced practice nurse or someone taking a lead within the clinical, so they can take their clinical tracks. If someone would like to become educators, they can take their educator track. And if they want to become a public health specialist, they can take the public health track. So this is all our master's program. We would like to increase on maternal and child health, and also in the mental health, which is becoming a biggest problem, not only Pakistan, but all over the world, which is basically post-corona effect. And you can read my article about post-corona mental illnesses and how it is, compromising the health of the people, is doing a lot. So that's why mental health is so much important. We also have PhD program in Pakistan. In Pakistan, we have more than 20 PhDs now, nurses, and then from Aga Khan University, we have only one. We have only graduated one, and hopefully we will be graduating more. But within Aga Khan University, we have 11 PhD nurses who are working as a professor, associate professor, assistant professors, and also leading many of the or departments like quality control, teaching learning department, and similar department like this. We have so far graduated 5,000 students, and then they all have come out not only from undergrad, but diploma, undergrad, post-RN, master's, and PhD program. And the best thing is that we all are connected with them, and they give us a lot of support and energy. So this is, I don't know whether you can see me, I'm standing at the back. I was a very quiet person and used to stand at the back. And today my students can never accept my comment. They say it is not possible that you used to stood at the back. You are a person who is always in front. This is what I have got it from Aga Khan University. In Pakistan, if we look at the nursing, it's very much different what we have at Aga Khan University. So many of the issues we all can identify, we have already heard from other participants, is there very much present at national level, however, very much controlled at Aga Khan University. So as soon as I did my diploma, I did my midwifery. At that time, it was necessary to get a midwifery. And then I went for my post-RN BScN program, and I was pretty lucky to receive the 5 awards out of 7 was available. And this was only possible because I had wonderful faculties, wonderful teachers, wonderful system, as well as wonderful patients. The story, when I was hearing, I have many similar kind of stories of my own life where patients have supported me a lot, where relatives understood that she has been working for the last 24 hours, and they used to say, sister, you go and sit. We will ask someone else to be able to get this task. And I used to say, no, I really have to do it. This is my responsibility, so I need to get it done. So that kind of commitment, that kind of support, that kind of personalization gave me the opportunity to progress. I started working as a community health nurse, where I used to take care of the maternal and child health only, and then slowly and steadily, I started working with the diversity of the population, like the disabled population, transgenders, many of the minorities living over there. Like we have a very small Hindu community living over there. So I started working with them to be able to ask for their rights, for the enrollment of the children to the school, and many, many things like that. I also identified that people were having their own groupings and they did not want others to participate, where I worked a lot with the communities, with different national stakeholders, including Ministry of Health, politicians, and many of the media used to work with me. And then I became faculty, and then now today in front of you, I'm interim dean at moment. This is to share that we take our students to the community for actual hands-on practice after they have cleared their community-based simulations. So we have community-based simulations also. They need to make sure they are a part of it, and when they are ready, then we try to take them to the communities. Here I am also presenting. I was being picked up by the UNFPA that why don't you tell us what are the gaps within the curriculum of nursing and midwifery. So I have gone all alone, all the Pakistan areas, and you all have the understanding it's not easy for a woman to travel. But as a nurse, I learned that even whatever we are doing, if we have a courage, if we have a passion, we can do it. So I identified some of the gaps and presented in front of my entire Pakistan Nursing Council and Midwifery Council. And based on that, they made a lot of changes. So, and those changes are still there, but with the time, we are still making a lot of changes because, and this is the Aga Khan University who's mainly taking the lead. Higher Education Commission contacts us, and they try to ask us that why don't you tell us what should be further included within the curriculum and operationalization of it. And then we are trying our best to be able to do that. Though it is a lot of work after our duty hours, sometimes 12 hours of work, we have to sit and work for the national level, which is a lot of work for us, but still we all are happy to that. So we try to graduate our students to be able to match at the level of international benchmark. And that's why you must have heard that a lot of nurses been absorbed who have graduated from Aga Khan University at national and international level. Honestly speaking, 80% of our graduates are the leaders of the School of Nursing. They are leading the School of Nursing, which is showing the impact of Aga Khan University nurses within the national level. However, due to so many challenges, they are unable to perform the level what they are supposed to be performed because of so many other challenges, which I'm going to talk within few seconds. So this is the first challenge we are having, you can see that airplane, a lot of nurses are sitting on that airplane. This is basically artificial intelligence generated picture. It's not the actual picture, but I wanted to show this, that we are having a lot of challenges, that nurses who are graduating and who are supposed to take care of at Pakistan level, they been offered a very good jobs and then they leave us, which is a very good for us overall. As our absorption is increasing, overall marketing is increasing. But on the other hand, we also have brain drain, and which is the biggest limitation for us. As earlier presenters have already highlighted, that we do have national level policy gaps. There are policies available, but no one tried to enforce that. And then people try to interpret policies based on their own understanding. Advanced practice nursing, it was the part of our policies, and the act, but somehow they are saying that advanced practice nurses is not the part of a policy, it's just the specialized nurses. The name being used is not incorrect. So those kind of challenges we are having. And then another biggest policy is low salaries. Salaries are so low that nurses are having difficulty to run their family. It seems when an operation theater is done, the surgeons, technicians, and nurses, when they leave Aga Khan University, doctors are, surgeons are taking a car to go. Technicians are having their bicycle, and nurses are waiting for the public buses to be able to, and then they hardly get the place sometime. So we do have transport system, but some of the nurses do not want to utilize that, or transport system is not going towards their home, which is too far from the Aga Khan University, so they are taking buses. So we are still working on that, but at national level, nurses are having far worse situation, whatever we have at Aga Khan University. So there is either slow or no career growth at national level. There is a backlash of advanced, as I said already, and then there is a negative image of the nursing. I really would like to share that in one of our International Nurses Day, we invited a top-class media person. We thought that she is someone who is also a scholar, who understand everything and all. And then we invited her to give a talk in the International Nurses Day. While she was talking, she unintentionally used a word which has been taken very negative for the midwives. So she used a very traditional, uneducated, person who used to conduct delivery, a word. And then suddenly she tried to cover it, but everyone heard it. And then people were discussing a lot, and then they were saying why you did not pick up the right, but she was the right person, but it's the image being created in such a way that there is a slip of tongue of the people when they are hearing many things from all over the places. So they call nurses, they do not accept nurses as profession. And then those nurses who try to speak up, they really would like them to be away from their department or their wards or their hospital. They do not want to have nurses who really speak up. And then the best thing is that at Aga Khan University, we speak up. And with our speak up, we get a lot of opportunities, but we do have to speak up. So Aga Khan University is still the part of Pakistan. So we do have trickling effect of whatever is happening at national level to the individual level. Other challenges are definitely, we have Pakistan Nursing Council. They are working a lot, but there is a change of president in the last 5 years so frequently that none of a president could work, with the full strength, with the full time given. They are being criticized so much. They are being called to the court so many times that at the end, they or their family gets so much fed up that they do not want to continue with that. I was being offered to become a president, and I said, I can't really take up this role because it's not easy for me as a woman to go to a court and stand in front of a judge all the time and answer. And I said, whoever will be the president, I will definitely be a right hand of that person. And that's why I am chairing the Academic Committee of Pakistan Nursing Council at the moment, supporting the president at full strength. And she's also one of our graduate and my student, so that she could face and all. And we all nurses are supporting her. I also need to highlight that violence against nurses is becoming really, really common within Pakistan. You know, it could be anything. Either identification is there now. People have started realizing this is the harassment going on with me. This is the bullying going on, and they have started disclosing it right now, right? So it could be both. Either it has gone up, or that they have started identifying. The good thing about Pakistan is that after Corona, finally, the president, we had a president, the previous president, Pakistan president, realized that this is because of nurses we are able to fulfill, because doctors were there only for a few minutes, but it was the main nurses who was working day and night to be able to protect themselves, and the patients and patients' family, and ensure that their care has been given at the highest management level with a smiling face, and with the passion and love and care. So then we celebrated that year, and the good thing is that our nurses have received they are receiving scholarship from the government. So at Aga Khan University, we are having 150 students in BScN program, our 4-year BScN program. 100 students being sponsored by the hospital, because hospital would like to retain them. So this is our strategy to retain them, and rest of the 50 students, they are getting some scholarships, like I said, nest scholarship from government, and also our donors and our alumni. Our alumni are putting in endowments so that some of the students can be we are calling it adopt a student, so that their fees and everything could be paid, and then they can graduate with that. But we are not putting any bond on them, because we want them to work anywhere within the Pakistan or in Asia, so that they can help others. So how I am managing my professional life, honestly, it is very difficult. I am the president of two board of and who are working. They are the NGOs working very much in the area of violence against women, violence against transgenders, and also women empowerment. And also my weekends are usually very much busy. And then Aga Khan University, as I told you, it's very difficult to maintain our work-life balance, because it's sometimes 15 hours, 12 to 15 hours we have to work. And then if we have donors who are supporting our students, we have to support them. And it's important that we need to take care of our stakeholders. When government, last time when we have interim government, the interim prime minister came, and then he met with all of us. He highlighted some of the issues, and we tried to help him out what need to be done. So it's not easy, what I'm trying to say, but still I'm doing it. And you could see that I'm standing with my students. These girls, some of the girls are very shyful. They come from up in the mountains. They do not mingle with people, sit quietly. So I try to come out from my office and to sit with them, talk with them, get them pictures, tweet, and then they are happy, tweet them, and they are really happy, and then try to talk to them what is happening and all. We also place Zumba exercise meditations, and usually it's me and two of my faculties, we are running together, and students enjoy that so much. And then we try to, ask them what innovations they want to bring in. One of our students said, I want to start a journal. And I said, okay, why don't you come to my office? I called the entire research unit team to be able to discuss how he could initiate that. It is not been done still, because you know that national level approval of things are not as easy as we think. So it happens. I notice a lot of people are burning out. Sometimes I realize myself that I am also burnt out, but still we try to keep open communication. So I have set up a time that tea with Tazeen, anyone can come, cleaner, nurses, faculty, students, parents, anyone can come. They can sit with me, chit chat, and then I try to take notes and to be able to help them. Faculty and staff performance reviews are the main kind of core practice which is helping our people to improve, as well as if they have done a good job, their monetary benefit is attached with it. So this takes most of my time. My first term, my first 3 months of the year is with it, but it is helping a lot. So it's important. I try to ask my staff, those who are having younger children, they should leave by 5 p.m. The work is done at 5:45, but I try to tell them to leave. If they want to come little late in the morning, they can come, and try to adjust with the paid, unpaid leaves and all. We give them support to travel to different part of the world, to be able to present their papers, to learn, and to explore their further studies. And there is a kind of constant counseling going on within the AKU. And we have 4 counselors who are working with it, and they are closely working with all we have 6 deans of different entities working with all of us. But honestly speaking, as a faculty professor and a dean, it's a lot of work. My time is going towards the counseling, and we are also having faculty development award. We started with the teaching award, then now we have a best faculty clinical award, and we also have a research award. Soon we will be having collaboration award, climate change award, those kind of awards, to be able to encourage our faculty, staff, and students. So this is done by Medical College. Dr. Narjis is the psychiatrist, the head of the psychiatric department, and then I am standing with my faculty, Jonathan. So we made sure that to become a part of the march, so that we could really tell everybody that we are together and we maintain equality. I have picked up Fatma's picture, especially in my office, because Fatma, when came first time to AKU, she's a dentist. She was so much afraid of everybody. And then she came to my office. She said, 6 people have refused, that they cannot really supervise me. Can you do that? I said, we have only 3 days left. How are you going to? She said, I will work day and night, but submit my the synopsis. And then I worked with her. And then finally she has got her job in UK, and she has already moved over there. So I wanted to show that we are trying our best to transform the individuals, but it is very much personal also. Other than the system is definitely existing, but I still feel that it is very much personal level. You can see one of my male graduate. He came from the mountainous, very, very sensitive area. And then he came to us, and then he wanted to work in his area for the nurses and all. And he did that. And we are really proud of him, because it's not easy to go into a very insecure areas to be able to work for the nurses and raise their voices. So that's why I picked up his picture over here. So as I said already, that the future of nursing in Pakistan is definitely, we want to bring in more PhDs, but many of the stakeholders are not happy that why nurses have to go for PhD. So sometimes suddenly we have a policy that nurses don't need to go for PhD, they can become professors directly. And we completely understand under the carpet what is happening. Many of our team members or stakeholders do not want nurses to go for PhDs, because as nurses are becoming scholars, they are able to conduct researches, identify what is the issue, have started raising the voice, and then also participating in a strategic planning and directions. Many of our stakeholders do not want that, but we will still be struggling for it. We believe that outcome-based curriculum should be a part of it, because at the end, nurses have to practice as a educator, as a clinical, as a community, or as a champion of different simulators and all. So we are transforming the entire curriculum towards the outcome-based curriculum, and we are looking forward that national level it will be adopted soon. Slowly and steadily, we are also moving towards the blended learning, especially for our master's and PhD program. And for undergrad, we strongly believe that it should be face-to-face, mainly because clinical practice, contact with young students, then when they come to us, they are 17 to 18 years old. Very few of them are 19 years old, very young individuals. So we really would like to, stay connected with them. So it's important that nursing force should be there in Pakistan. We need to have nurse-led more clinics. At moment, we have nurse-led lactational clinic, and our 2 of the faculties are already running that clinic. I'm so glad to share that that national level, it has been adopted and accepted. At national level, the group of doctors and nurses working together to be able to initiate the role of a nurse-led clinic for diabetes mellitus. Family planning clinic, like I have been working, I used to do couple counseling. Family planning clinic is already there, but the recognition was never been given that it was run by the nurses. This is the biggest issue. So we need to increase the engagement and participation on national, international level and national level. And that's why I'm a part of this group. When I received the invitation, I said, I want to be part of this because together we can make a lot of difference. And we should have equal voice given to nursing leaders from low and middle income countries. Nothing against of anybody because we are working closely with all over the world. But I think the time have come that we should also see leaders from the low and middle income countries. And today I can see many of the leaders in front of me, and I'm really proud of it. So this is one of our students, also came from up in the mountain from a very difficult area, and she graduated from us, and she was so much excited on her graduation day, and that's why I've picked up her picture. This is my contact details. Any one of you would like to work with me, we will definitely be working together. Thank you very much.
Thank you very much, Dr. Tazeen Saeed Ali. That was spam. I really don't have, words to express myself. But then what we could also, talk to you about and share something which we have in common are that as you spoke about education and development, as you proudly spoke about nursing leaders, as you proudly spoke about the voice of nurses in a forum like Nursing Council where it matters, this is something which we closely relate to. We're very happy that Khakha University as an institution is an autonomous body and is able to take the voice of nurses ahead. Congratulations for all the good work which you have been doing, and best wishes for it to continue in the future. Thank you.
Thank you. Thank you very much.
We welcome our next panelist, Kumari Rai. She is the president of the National Nursing Association of Nepal. We are very proud to have leaders of each country as a part of this forum to express the voice of a large amount of nurses in their country. And as many of our panelists share, we common in Southeast Asia share certain forums of nursing which we relate to extremely closely. Welcome, ma'am Kumari Rai. We would like to hear more about the nurses from Nepal.
Thank you, Phalakshi, and namaste to everyone. Thanks to the organizers and my fellow speakers, and giving me an opportunity to speak about the nurses in Nepal. So first of all, I'm going to present the status of nursing in Nepal. So the working in government hospitals, there are 18,000 nurses working in government hospitals. In private hospitals, 18,000, and nurses who wants to go abroad from Nepal, and they need to apply for the verification for their certificates. So they apply for 39,000 nurses would like to go to abroad, and the total employed is 65,590, and unemployed, among them unemployed is 44,000. That can be changed job, default, and retired and deaths. So altogether, there are licensed nurses in 1,15,000 nurses in Nepal. So the nurses, among them, would like to go to the America is the most. So there are 22,000 and 11,000 in Australia. And the population's doctor-nurse ratio of health workers is less than 1 in 1,000. So categories of nurses, production and allocation is service providers who are in government service are auxiliary nurse midwives, staff nurses, who is also said with diploma nurses, and the staff nurses, nursing officers. They are from level up to the 11th level, and academic science like educational institutes. They are lecturers, readers, associate professors, and professors. These are the nursing manpower working and allocated in the academic and services. And the academic qualifications for the auxiliary nurse midwives, they study for 3 years after SLC, that is class 10, and PCL or diploma, that is also 3 years course, which is called staff nurses, and also include in midwifery also. And there are 2 types of bachelor nurses. One is graduated from staff nurses who study for bachelor nurses, and other group is BSc nursing, which comes from +2 science background. So there are 2 types of bachelor nurses, and there is a masters of nurses, study in masters after bachelor of nursing. It is BN 3 years and BSc 4 years after graduation. They are eligible to do a master's degree. And there is also bachelors of midwifery that is started very new, and this is 3 years course. And there are masters, 5 specialists like women's health development, maternal, that is maternal and child health, adult nursing, pediatric nursing, and this is entry from BNS and BSc. And there is also a PhD program, one program in Tribhuvan University College. The impact which we have been through all the world, nurses, we went to the pandemic, that is COVID-19, and since 2020, COVID-19 has massively affected the treatment and care of accessories to the public and Nepal and health care professionals, including nursing. Nurses were and are the major frontline healthcare providers during COVID-19 pandemic in Nepal. Due to the inadequate mechanism and its regular practices, trainings, and nurses faced a lot of problems during pandemic crisis situations. There were a shortage of nurses to care the sick people in all healthcare institutions, that is grassroots level to the tertiary level. Due to the COVID-19 infection to the nurses and fear of infection, many nurses left the job. This was the trend when the COVID was there. In the second round of the COVID, most of the nurses were left the jobs. Many of them left the job due to the fear of infection and the loss of jobs. And also there was a social stigma, no entry to residence. Some of the nurses were not allowed to go back to their residence, like in a home or in the rented home. So they were restricted to go into their home, and they were forced to live in the hospital. And fear of transmit of COVID by herself to the family members, isolation from family members, and especially with the young kids. Some of the nurses have lost their jobs due to the COVID-19 infection. Nepal has faced critical situation during COVID-19 pandemic management due to shortage of nursing staffs because of rapid rising hospital admissions, because there were so many patients admitting in the hospital, and there was no nurses, a few nurses who has to care them. Need of ICU care with ventilators, oxygens, and medicines demands. Poor, ineffective, and even lack of all medical supplies and poor nurse-patient ratio placement. Many nurses infected with COVID-19 due to the lack of knowledge and critical care skills about COVID infections and transmission, new disease in critical care settings. Role of government and different organizations during pandemic. Nepal government formed a high-level COVID-19 Control and Management Committee, CCMC, in the leadership of Deputy Prime Minister, followed by the committee formed in the Ministry of Health and Population, chaired by the Health Minister, including non-president, as a member of the committee. During the situation of crisis, earthquake, COVID-19 pandemic, as well as road traffic supplies, including nursing workforce. Nursing Association of Nepal, nursing leaders from Ministry of Health and Population, nursing divisions from universities, hospitals, nursing colleges has played a management role significantly. On the call of government, nursing and health professionals leaders had been asked to join the duty who were on leave and study leave. They were also asked to come and do the duties for the COVID patients. The non and the government nursing officials had actively coordinated with provincial and local governments, nursing leaderships to solve the nurses' problem regarding management of COVID-19. Nursing Association coordinated with health institutions, government and non-governmental organizations, managed quarantine isolation centers and accommodation during the lockdown, especially for doctors and nurses. Conducted online trainings for infection prevention and control, stress management measures, online yoga sessions, coordinating with external partners with the major activities. During the pandemic crisis, NAN also managed to serve the victims in affected areas according to with locally employed nursing leaders and government officials. Regulatory nursing education and services also work together. NNC, Nepal Nursing Council, is responsible for licensing examination for registration nursing, is planning to conduct specialty registration examination in near future for nurses with master's degree in different specialties, leadership role within the profession, which is going to be, the license examination also started and going to be replaced in the working areas. Challenges for the government and for the nurses during the pandemic crisis, and also for the regular basis also. Infections to the nurses themselves, left and lost the job, as well as the unpaid leaves, social stigma, psychosocial problems, fear and anxiety, difficulty use of PPE. It was very much difficult to nurses to orientate to wear, put on the gowns, PPE equipments also. Difficulty in PPE, lack of awareness, shortage of resources, managing resources, human, like doctors, nurses, and paramedics. Medical supplies were also lacked, and the hospital beds, or especially ICU beds, were lacked during the pandemic, and still there is a lack. Unknown due to the lack of evidence, data, research, and new disease, because the COVID was very new, so the nurses were also unknown about the disease, and some of them lost their life also. Managing and disposing dead bodies also where the problem and social isolations, because the families were restricted and the relatives also restricted, so that the people and the nurses felt that they were socially isolated. Neglected other medical conditions, like due to the COVID, everybody's attention were given to the COVID patients and other, kind of like diabetes, hypertension, and heart disease were neglected during that time. So that was also the problem for the nurses to manage for their patients to give care. Challenges on profession. Due to that crisis and also in a regular basis, there are so many challenges. The challenges to the nursing profession in Nepal includes gap between nursing curriculums and practice, because there are new kind of diseases are there in evidence, but the curriculums are traditionally developed and designed, so there is a mismatch of the curriculum and the practice. Poor working environments in the healthcare settings, because a lot of shortage of resources. Nurses have to manage a minimum kind of setups and resources. So that is also the problem. Lack of collaboration between nursing services and the education institutions, because the education institutions were closed during the pandemic, and the nurses were not sent to the hospitals to work, because they were fear of transmission in their families. So that was also the kind of lack between the coordination between institutions and the hospitals. There are other regular kind of things are delay promotion, poor working condition, and low salary. The delay promotion is main problem here in Nepal for the government service who are working in government nurses. They are delayed for promotion because the staffing is not structured, because there should be a local government to announce to give the staffing and increase the structure, but there is a delay, or very minimal posts are there, so they delay for the promotions who are eligible to promote, but they are not. So lack of mentor and involving nursing professionals in policy making level. There are very few nurses who are involved in policy making positions. There is a nursing division in government, but they are not involved in policy making. Very few times they are invited, but they are not in the regular basis. It's voice for the policymakers and make nurses kind of highlight in the policy making. So this is the lack for the nurses. And qualified, skilled, and trained nursing workforce is migrating. I think this is already said by I think Bangladesh also said that. Nepal is, in future maybe we will be lacking for nurses, qualified nurses. They are migrating to the USA. That is 22,000 people are affected. And UK has done MOU with Nepal. So they are also applying for to fly UK, and there are 61 nurses already passed the exam, and I think they will be migrating soon. So the headache for Nepal government, I think, in the future, because we will be losing our nurses, qualified nurses in Nepal, and they will be flying out to other countries. And there is a lag in nurse patient ratio. I think this is all problem for the developing countries, because we have very few kind of allocation of budget in health, and there are the nurses who are very much poorly paid. So nurses, staffing pattern is also not there. So the structure is not met according to the nurse patient ratio. So this is lacking in our country also, and that's why there is burnout syndromes, like nurses who are overloaded and need to work in long periods. So there will be a very low quality of nursing care to give the patients. Threat of nursing shortage in future, especially in critical care areas, because the developed countries are demanding like critical care, mental, psychiatric care like that. So all the nurses who are trained in critical care and psychiatry also. So there is in Nepal. So this is the headache for Nepal government also. In conclusion, I would like to say nursing workforce and education institutes are not managed adequately and appropriately. Migration of qualified trained nursing workforce for better opportunities. Nurses are employed, unemployed, underemployed, and exploited, especially for private sectors. In private hospitals, they are very low paid. Lack of collaboration within clinical and hospital settings and educational institutes. I already explained about it. Inadequate nurse-patient ratio. This is the headache of present time also, because there is a very low staffing pattern in the government settings and also in the private also. So impact of COVID-19 and nursing professions was very critical during the pandemic in Nepal, especially in management of resources due to the shortage of including human resources. This is all about the not nurses only. There were doctors lacking, health workers lacking in that time also. Pandemic makes the nursing profession very panicked, feared, and exhausted and frustrated, because many of them were forced to live in forced leave and low paid, and some of them were lost the job. So this is a very fear and exhausted, as mentioned here. At the same time, to be prepared for the resources in any crisis situation, work together, managing resources, appropriate and economically, and learning to use new technologies, online classes, training, etc. But it, as we already said, that pandemic has given us so many crises, but we have learned so many things also to manage in the crisis situation in minimum low resources also we managed it. So this is also a lesson learned. Government and different professional organizations have made great effort to manage pandemic using different resources, crisis, national and international, in Nepal. So we have learned how to coordinate, because the nursing association was a little bit based on in the nurses profession only, but we all health workers, doctors, health professionals, and the ministry level people, we work together to solve the crisis accordingly, and in minimum resources we we solved the problem. However, it was very painful, but we managed it. So we learned that the crisis also given us a chance to coordinate and communicate with other organizations and other organization fellows also. So this was the the pandemic, and all situations have given us the lesson. So we have to work together internationally, nationally. So we organizations, we national and international organizations like nursing associations, we work together. So in future we would like to work together also. So thank you for giving me an opportunity. This is my presentation. If any questions are there, so I am ready to give this. Thank you. Namaste.
Thank you, ma'am. You have aptly summarized the current situation in Nepal. We are very happy to hear you, because this is the voice which we would like to know more. As we said a few minutes ago, Southeast Asian nurses, we have many things in common. And as you said this, we understand what is the issue out there and how you have been bravely taking it forward and able to combat it. Congratulations for all the efforts you have been taking to the nurses. Thank you.
Thank
We
you.
welcome our next panelist. We welcome our next panelist from the beautiful country of Maldives. From Maldives, we have the President of Nurses, Mrs. Mariyam Shifaana Hussain. We would like to hear more about the nurse's voice from your beautiful country, ma'am.
Thank you, ma'am.
Kulunuge firumun takum firuma Lobu vetinaruhum midwife Kulunuge firumun takum firuma Lobu vetinaruhum midwife
Divagi muralikam fenida Khitumetteri naruhum midwife
Mihikam jazira ge dulahekam Ayukura mihi vissai ko tayyare naruhum khidumekura Mihikam jazira ge dulahekam Ayukura mihi vissai ko tayyare naruhum khidumekura Khidumatuge daura oy minvara sihi dairaga
Kurierubum maqsadaki ihtiram libegotuga
Khidumatuge daura oy minvara sihi dairaga
Kurierubum maqsadaki
ihtiram libegotuga ihtiram devegotuga Mihikam jazira ge dulahekam Ay mihi vissai ko tayyare naruhum khidumekura Mihikam jazira ge dulahekam Ayukura mihi vissai ko tayyare naruhum khidumekura
Hi, good afternoon and good evening, everyone. I am Mariyam Shifaana Hussain. I am currently the president of the Maldivian Nurses Association. The video I just showcased the work that we do and what we are about. The music that you hear in the background, that was actually the song for the Nursing Now campaign that we launched in 2000, because that was supposed to be the year of the nurses. But unfortunately, COVID hit us and we were not able to go forward with much of our work. So now I'm going to tell you a bit about nursing in the Maldives. As you can see from this map, we are very far away and we have the ocean. So we do have a few logistical problems when it comes to nursing, because each and every single one of these tiny dots that you see, some of them are atolls, most of them are actually islands. In each island, there will be people living. So a healthcare facility is needed. So you can imagine how the burden of it would be for the government as well. And the picture that you see here, this is actually the first mobile nursing of the Maldives very recently. There are many NGOs formed by nurses who are working in the community as well, because we are also trying to go forward as a country. Yeah, so good day again. First off, I would like to thank the Unitar Cecil York at York University, in Toronto, Canada, and Nightingale Initiative for Global Health, NIWorld, for this wonderful opportunity to present on this amazing platform. To all the listeners, thank you so much for joining. As this is the holy month of Ramadan, I'd like to open with a few verses from the Holy Quran and a special dua to all my brothers and sisters who have been touched by war, famine, and calamity. May Allah grant you ease. أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. اقرأ باسم ربك الذي خلق. خلق الإنسان من علق. اقرأ وربك الأكرم الذي علم بالقلم علم الإنسان ما لم يعلم صدق الله العظيم. As you can see in these verses, in the name of God, read in the name of the Lord who created you. Created humans from a clinging clot. Read, and your Lord is the most gracious, who taught by the pen, taught humanity what they knew not. So I think it is this verse that is actually very close to our hearts of the Maldivians. This is actually the first verse of the Quran. This talks about knowledge and how important it is. So this being the first verses, it shows how much we should actually seek knowledge throughout our lives. So the Maldives, officially known as the Republic of Maldives, is a country, an archipelagic state in South Asia in the Indian Ocean. The name is derived from the Sanskrit word Maldiva, which actually means the garland of islands. As you can see from the first map that I showed you, it's actually like a garland. The Maldives chain of 26 atolls stretches across the equator from one atoll in the north to Addo Atoll in the south. Including the sea, the territory spans roughly around 9,000 square kilometers and a land area of 298 square kilometers. There are 1,192 islands, of which 187 are inhabited, which means these people would be needing healthcare services. We are a 100% Muslim nation practicing Islam, basically the message of peace. The Maldives is one of the world's most geographically dispersed sovereign states and the smallest Muslim majority country by land area, with a population of 515,132 in the 2022 census, that is the most recent census. It is the second least populous country in Asia and the 9th smallest by area. So you can imagine the number of people per square feet and then the health calamities that it could actually cause. The Maldives became a founding member of the South Asian Association for Regional Cooperation, SAARC, and the Maldives is also a member of the United Nations, the Commonwealth of Nations as well. The World Bank classifies the Maldives as having an upper middle income economy. During COVID, we were very fortunate. We had access to medication. As soon as the vaccination was available, we had access to vaccination. We had access to all sorts of medication. And then the most difficult area for nurses and other healthcare professionals across the world was actually the availability of protective measures, but we had that, alhamdulillah, in abundance as well. The Maldives rates high on the Human Development Index. The census shows that education is actually on the rise, and then a lot of our youth are actually going into nursing, because I think maybe after COVID, everybody realized how important a nurse is. We had shortage of nursing in our country as well, and due to the travel restrictions, it was very difficult to bring people from abroad. As for the nursing practice and the Nurses Association's role in it, I am practicing as a registered nurse in Society for Health Education. My work in Nurses Association is actually volunteer work that I am doing. The work in SHE that I am doing is I am a sexual and reproductive health nurse. SHE is a member association of International Planned Parenthood Federation. I would like to say nursing is my calling, and then I have been doing this wholeheartedly. There's so much out there that you can do once you become a nurse. The board of MNA consists of all working nurses in different parts of our country from different atolls. Most of our meetings are conducted online because we cannot regularly meet up because while the area is very far, we actually have to pay a lot to travel from one island to another. So when we do volunteer work to achieve the goals of the professional nursing in the Maldives, we do face challenges, but I would like to think that we are actually making quite a lot of progress. The challenges we face in the workplace and community. The top 3 challenges we face in our country is actually quite similar to those of the ones that we just heard. I was very surprised. I thought it was just a Maldives thing, but apparently I know it's global, but I think in this Asian region, we have a lot of similarities as well. Obviously, staff shortage is there, nurse-patient ratio problems are there. Difficulty in retaining staff, especially local male nurses, is a bit difficult because there is still the stigma that, any caregiving role is a female role. The second one I would like to highlight is challenges due to geographical nature of the country and how it is decentralized, and in an island level hospitals, they lack resources, and how the referral system is, because to refer a patient to the regional area, you actually have to travel by sea. We do have sea ambulances, and alhamdulillah, we are covered by the government insurance scheme as well. So we do have these things going on. We are actually very privileged, but there are, because traveling takes time, and then some instances are there that time is equal to the loss of a life. So we do have that challenge as well. The other one I would like to highlight is limited number of specialized scholarships, the need to develop effective CNAs to ensure nurses all around the country are up to date, providing EBP, and need this as a whole to ensure standardization of our services. Like I said, the majority of trainings and education is available in Male, the capital city. If you want to, because according to MQA, the qualification authority, any medical related course has to be a physical presence. You cannot do these things online. So very few programs are available online. They are, but to actually upgrade yourself, you have to take a physical class. So the geographical limitation is there. Then the need for specialized courses to be available in Maldives rather than going abroad, because as of now, the only masters we have here is a general masters and an academic masters. So to even become a specialized nurse in any area, you need to either get a scholarship or save up by yourself, and then you need to go abroad. So that is one of the main challenges that we face in Maldives. As for the solutions, just talking about the challenges that we just faced, I think the number one would be for the male nursing and the lack of retention. We are advocating the profession among the youth and making the public more aware of the benefits of the nursing as a profession and the vast scope of practice that we have. Our current scope of practice is actually under review. And then to give more scholarships, and MNA has taken the initiative last year when we turned 15. We have actually started granting scholarships every year, 1 male and 2 females, so that at least 1 male nurse would be graduating every year. As for the second one, we have selected nurse leaders from all the regions of the country and have effective communication mechanisms among them so that they do not feel isolated or out of touch or out of communication throughout their work. So we have this group where all the nurse leaders from the islands and atolls, they can actually talk whenever they need to. And we also conduct CNE sessions bi-monthly from MNA to ensure that the nurses in the islands can join. We have online sessions such as medication dilution for emergency care nurses and values session, basic life support session and such. We also facilitate sessions as we get suggestions from our members according to their needs and priorities. When we come to nursing the nurse, for me, my self-care is actually spending quality time with loved ones, so friends, family, colleagues, sometimes people who I volunteer with. I also make time out of my schedule to volunteer. It is a daily practice. The act of giving is healing, and the practice of gratitude, it actually keeps me grounded. So apart from my full-time nursing job, MNA is like my baby. So I work with Nurses Association every day because we get a lot of calls and a lot of issues as well, and then we have to actually answer to them. I'm actually also currently on another board. We do have a member association of IFRC, the International Federation of Red Cross and Red Crescent Societies. The Maldivian Red Crescent, I am also on the board of Mali City unit, where we have the emergency plan as well. So whenever a crisis situation in our city arises, I would be part of that as well. Especially since COVID, we have noticed a significant drop in the number of nurses and burnout amongst those who have stayed behind. Signs including issues of taking leave or inability to cope with the demands of nursing. For those of the nurses that I am able to reach, my advice is usually to take time to unwind and de-stress. Sometimes something as simple as a yoga class, an exercise class, regular exercise, balanced diet, spending time in nature. We have the ocean all around us. There is research that shows that the salt in the air, the fresh air, the wind, the direct air that comes from the ocean, it is very beneficial to regulate ourselves. So alhamdulillah, we are very near the ocean. It's very easy for us to just walk 5 minutes and find the ocean somewhere. And then if they need professional help, we advise them to seek professional help, like regularly seeing a counselor, therapist, or psychiatrist if needed. Because if your cup is not full, you cannot pour from your cup. And then the best one that has always worked for me, no matter how stressed I am, because my role in COVID was actually a sample taker, and I stayed away from home for months. I'm a single mother of 3 children, and staying away from my kids for months without seeing them because of the movement restriction was just the hardest thing that I've ever had to deal with. So it was difficult to seek a counselor or therapist as well during that time, because that help was also not available that much, because the number of psychiatrists that we had, most of them were from abroad, and they also had to move away, to be with their own families. We understand. So through that, I think through that experience, we all knew the importance. We always knew maybe, but that hit home, that care providers are very important, counselors are important, nurses are important, therapists are very valuable. And then after COVID, there was a rise in all mental health issues throughout the country. So obviously the nurses would also be bearing the brunt of this work as well. So to anybody and everybody, I would say seeking a counselor is like wearing glasses or taking your insulin shot. It's not a problem, it's the norm. You should seek help when you need it. And that is part of self-care as well. Finding work-life balance is very, very important. You need to take care of yourself if you want to help somebody else. There's no other way around it. As to answer the question of why is nursing so satisfying, or why do we stay with the workload, and as we have heard from our other panel members here, the bullying, the hardship, it's so difficult to travel, it's so difficult to go to duty, come back to duty, change our clothes, listen to these people. We absorb so much of our patients' complaints, so much of their pain. If we don't regulate ourselves, we might internalize these things, and then compassionate caregiving cannot be part of it, we will obviously feel burnt out. The meaning and purpose in my nursing practice is being able to provide aid and accessibility to the vulnerable communities, that is me personally, especially women and children. For me, having a nursing license is like having a master key. It opens the doors to so many opportunities that I didn't even know existed. As you can see from the verses I opened with that being the first verse from the Quran, which is read, this shows the importance of seeking knowledge. So I have this thirst for knowledge, and I think nursing has been the best decision that I've made in my life because I'm never bored. Like if work is hard, I can always go to my community. If that is, too stagnant for me, I can always work in a clinic, I can work in a school, I can take a day off, go work in a resort. There are so many beautiful resorts in Maldives, and each and every single one of them, they have a clinic, and most resorts, they will have a nurse. So if you want opportunity, the world is your oyster. And then becoming a nurse is the absolute most wonderful way to actually get the benefits the world has to offer. Being able to help someone in need is a different kind of happiness. To give back to the society, especially equipped with nursing knowledge, that's like gold. Sometimes it is easy to forget about the ripple effect of serving just one person. I have met many nurses who feel dissatisfied and they say, when I go to duty, I do this for just one person. I don't see the impact of it. And then I tell them the story about the starfish. I don't know if you all know this story, but I also have this saying in Bivehi. It's called Ekkupuloes Kandesha. That means, for example, say you have food for chicken, but only one shows up. Doesn't mean you get disheartened and say, oh, no need to feed the chicken. Even if it's just one, you feed it. And then it mattered to that one starfish story is there was this little girl, she was walking on the ocean near the beach, and then people were watching her. She was just, throwing one starfish after the other into the ocean. And people were very amused because there were endless starfish on the beach. And then they asked, why do you do this? It's not like you can save all the starfish. And then she said, it mattered to that one starfish. And then the people came and they joined, and everyone, they threw one starfish. And by the time, within a few minutes, all the starfish was saved. So don't think that just one action of yours or one person cannot change the world, or you have no impact. As a nurse, you might be serving just one person at a time, but it mattered to that one starfish. So never underestimate the impact you have on your community by serving just one person at a time. I believe that whenever a nurse is serving a patient, we leave our mark on the world and heal someone, not just physically, but spiritually as well. Alhamdulillah for our ability to serve our country, our nation, and our world as a nurse. What other more satisfying way than helping somebody to heal and helping them save their life? As we look into the future of nursing education, the number of graduates are on the rise in Maldives year by year. Back when I was studying, there was only one faculty, that would be the National University of Maldives. Now there are two more. And then the nursing masters also have begun recently in the Maldives. That is a general nursing masters. And then, if I'm not mistaken, academic one as well, nursing administration. Nursing scholarships were started by the previous government very recently. Most people are not aware that nursing actually is a specialized field, or that you can become specialized as a pediatric nurse, as a renal nurse, as an onco nurse, or even as a community nurse, which is where I think my passion lies. The first nurse specialist of the Maldives was announced just last week. I do believe that it's a milestone and hurrah. There are nurses who have PhD and double masters as well. The thirst for academia is ever increasing, and you can see it rising like a wave in our community recently. MNA has also started contributing to this. Like I mentioned before, we have introduced our own scholarship in collaboration with Villa Foundation. We have started basic life support training for the public. We are working on a book, Caring for Senior Citizens. We won a grant through Asia Foundation. Focused on women's health, we have started breast self-examination for the public. We are teaching it. And since we have noticed this trend after COVID of the workforce leaving, we have actually started doing a research, the M&A research on nurses. It's named Psychosocial Work Environment and Intention to Stay in the Job among Nurses in Tertiary Hospitals of the Maldives. So we have been working on this research after COVID as well. When we look into the nursing workforce, we can see that more and more youth are joining the courses, which is a very good sign. Even though retention is a big issue here, local nurses are being produced. Student male nurses have also significantly increased. So the current batch has around 10 nurses, but back 10 to 20 years back, you could find till now there are, I think, only 5 male local nurses. So the current batch having 10 male students is a very big step, I think. With the recent National Pay Framework under the National Pay Policy Act 11/2016, the nurses' job matrix was announced with a lot of nurses' increments and new positions like specialist nursing, which we believe will help in retention because now the nurses will know that there is actually a ladder, steps that you can go forward in your career. So it will help with retention as well as educating themselves and finding the latest EVP practices. While these positive things are there, we also have the issue of brain drain, where a lot of educated nurses are leaving to experience other countries. As our sister mentioned before, it's good, but since we do need our local nurses, everybody wants to be treated by their local people, their local language, our local culture. So that difficulty is there, but I think the only way to mitigate that is by actually producing more and then making sure that the nurses who graduate have better values and they are more, not only more educated, but more compassionate as well. Nurses as leaders in the global healthcare community. As the majority of the nursing workforce in Maldives is women, I would say around 99.9% of our healthcare nursing community is women. So since we are here, almost all the senior nursing roles in our community is also led by women. We do have a seat at the policy table. We get invited to these talks, to these discussions. But there's always room for more improvement. And I would say there is still a lack of inclusion when it comes to that top management level or the parliamentarian level. There, the number of women are less and no healthcare woman is there. So that is an area that we need to focus and actually build nurses to go sit in our parliament and work on our laws. Although Maldives has reached a relatively high level of health for all, ensuring budget allocation for national and regional programs, as well as increasing the number of scholarships available for nurse specialists, as well as nurse practitioners might be a good way to ensure that the underrepresented in the leadership positions would be addressed. So that is where our solution talk is. Providing more skills and training to the existing workforce and incorporate it into the existing nursing curriculum would also provide a step up to the younger generations. Along with the position of CNOs and RNOs, that would be the regional nursing officers, the voices of nurses in our region and country will help their voices be carried across to the policy table. We believe that our chief nursing officer is one position where it is very important in raising our voice. There is still room for improvement with effective mentoring programs where the younger generations are guided. Award and recognition programs, we have yet to have a national program like this. And additional schemes like childcare facilities and health insurance for the nursing workforce, especially because of the large number of females and our work hours actually. Even though the government states that it's 6 hours, 8 hours, some nurses are unable to go with the handover. Sometimes it takes up to 10 hours itself. So with balancing their life, it's a bit hard we used to live in very large families, but we are moving into nuclear families. So childcare is actually an issue. And then health insurance, I believe, is a must, uh, especially for the nursing workforce, aside from the national one, because our problems are a bit different. We have yet to make selection for chief nursing officer in our country, so that would be a day that we would celebrate. We are very proud to have a Maldivian Nurses Association, and these are our highlights. In 2019, we launched the Nursing Now Maldives campaign. In 2022, we held an international joint conference for healthcare professionals, where we had speakers from across the globe join us. 2023, the analysis and technical input for drafts of nurses' job metrics under the National Pay Framework. We did some technical work for that. Introduction of annual scholarship to mark the 75th anniversary of nursing in the Maldives. We had a lot of discussions with the government during COVID, and we worked directly in the COVID center, giving nursing services during the COVID-19 pandemic. In 2022, we learned that our national dictionary had a different definition of nurse, where it said doctor's helper. And then we advocated and we actually changed the definition in the national dictionary to that of an autonomous, educated person who can actually make decisions regarding patient. So I think that was a win for us as well. And in 2023, we participated in the health sector gender audit by the Ministry of Gender, Family and Social Services. And this year we partook in the National Elderly Policy Validation Workshop by the Ministry of Social and Family Development, which was held by the help of UNESCO. So like I mentioned before, we do have a seat at the policy table, and our words have actually been taken into consideration when decisions are being made at national level as well. We do thank our government for, the hospitality that is always extended towards the Maldivian Nurses Association. Yeah. Thank you all for your support in making Maldivian Nurses Association a success. I do hope that you have learned something about our beautiful country and our beautiful profession as well, and the way we work here and the way forward. Maldives has actually done a tremendous job in building back better after COVID, but like I said, there's always room for improvement. Thank you so much for having me. It's nice to meet you all. Thank you.
Thank you, Mariyam. That was fabulous and a great learning too. Maldives is a beautiful country. Today we know that Maldives has a very, very intellectually viable nursing president, and I'm sure Maldivian nursing personnel are very happy to have you as a nurse leader. Your story about a starfish was extremely touching. And I think what brings all of us together is our love for our nursing profession, is our love for initiating better nurses under our care. And I'm sure with such marvelous nurse leaders, we look forward to some fabulous growth for our own profession in whichever part of our country we are. Thank you so much. We open our session now to our student nurses. Students today, future nurses tomorrow, future leaders. We are looking forward to listen more from you about how you look at nursing from your own perspective, because you have a way of communicating with us as a global nursing personnel who represent your own parent country. And now you are a global individual who are able to, look at the world from a different perspective. We welcome Ms. Rosina Jafar to share her story first.
Good morning, everyone. I'm Rosina Jaffe. Thank you for having me to share my voice with the globe today. I am an IEN pursuing a post-RN BScN degree at York University, Toronto, and an alumna of the Aga Khan University. Throughout my professional trajectory, I have had various positions, including nurse manager, clinical recruitment, nurse supervisor, head nurse, clinical instructor, and a senior critical care emergency registered nurse. Additionally, in Canada, had an opportunity to serve as a faculty at Centennial College, Toronto, supervisor wellness nurse, and as a volunteer peer health coach at the Canadian Cancer Society. Honored that I was featured on International Volunteers Day and a trained prevention practitioner of the Better program. Conversely, I graduated with a distinction in Masters of Health Administration and received a merit award from Aga Khan Education Services for securing the second position on a board exam. Also hold a postgraduate in public administration, a bachelor's of commerce degree, and a remarkable number of publications. I strongly believe that my professional upbringing in the East, Middle East, and West part of the world made me well equipped to gain the values of the shared vision. Through my experience, I can emphasize and perceive nurses, regardless of their nationalities, as a global citizen of care due to the universal similarities of the human anatomy. I possess a deep understanding of the distinctions and the resemblance between my home country, Pakistan, the place where I have practiced, Kuwait, and my current permanent home, Canada. I strongly advocate through this platform the adoption of the best part of any culture, any profession and nation, and incorporate them into our own. First and foremost, the recognition of the nursing profession in the Western nation is significantly greater. Based on my observation, I have seen that in Eastern and in Middle Eastern nations, the nursing profession is often viewed as a marginalized profession, but they believe that the individuals from the less privileged backgrounds choose to pursue career in nursing. On the other hand, it is with the great honor that I acknowledge the recognition of numerous international esteemed institutions, including Aga Khan University, my alma mater. The visionary chancellor of the university, His Highness the Aga Khan IV, established a nursing school in Pakistan 4 decades ago. This initiative has transformed the perception of nursing in the country, leading to abundant opportunities for growth and excellence in the field. One of the factors in achieving this in today's contemporary society is through the utilization of AI, media, and technologies to facilitate global collaboration. While discussing the media, it is important to recognize the media's substantial influence and impact on the public perception regarding the nursing profession, especially in the Eastern region, particularly in the drama serials. Nurses are often shown as having a submissive role. I use this platform to make my voice heard in the Pakistani media to highlight the rightful recognition that the nursing profession deserves. Furthermore, the prospect of achieving personal and financial autonomy is another pivotal factor. In Western countries, nurses have the option to work on a full-time, part-time, casual, seasonal basis without being restricted to a single employer, which I rarely observed in Pakistan and in Kuwait. Moreover, the lengthy and frustrating verification of the registration process in Pakistan and in Kuwait is a crucial factor. The delay resulted in the expiration of the safe practice of many IENs. Critically, Canada should warmly and enthusiastically welcome IENs into their system, as the COVID-19 pandemic has demonstrated IEN's assistance in combating this fatal storm. Ensure that the process is professionally friendly so that the IENs do not spend their valuable years working in various temporary positions instead of their intended workplace and can regain their RN designation. I believe the strength of any community lies in diversity. I look forward to learning with the hope of spending my next step of the career contributing more to our healthcare community as a registered nurse leader. I will conclude my voice with the message impart to all my fellow nurses that never give up. You have opportunities waiting out there. Have a great rest of the day. Thank you.
Thank you. That was beautifully said. We welcome our next student speaker, Mr. James Yag. White. I hope I have pronounced your name well. Welcome,
Hey,
James.
yes, absolutely, no worries. Can you hear me well?
Yeah.
All right, awesome. Thank you so much for the introduction, and also Rosina, that was an awesome presentation. I really do appreciate. I actually don't have a presentation or video right now, but I want to use this opportunity to just share a little bit about myself and why I think like the work of advocacy is so important, especially for us as nursing students who are ultimately, looking on to become nurses in the future. So just for me, my name is James. I am a second-year direct entry nursing student at York University, and I'm also currently the president of the Canadian Black Nurses Alliance York University chapter. And I'm also part of the NSA. So NSA is Nursing Students Association at York University, and a little bit of work that I do outside of campus work is I try to advocate for mental health as much as possible. And I'm part of Kids Help Phone, which is a mental health organization for youth across Canada. So I'm really glad to be here today. And I also just want to take a few seconds to echo everything that everyone has said today, especially the panelists. I think you guys just like really heated or highlighted some very important points and just was very inspiring for me as a nursing student because my journey or what I'm trying to make my journey as is a journey that I can talk about for advocacy and to advocate for a better profession for us who are, about to enter the profession very soon. So I really do appreciate the work that you have done, and I just thank you guys so much. I wrote a little bit of notes. I'm just gonna look at the notes that I wrote, but I do want to say right now that advocacy is such a big part and so important in the nursing profession, especially with everything that we go through in nursing, because the profession can be quite draining. Even me as a clinical student who hasn't necessarily been in the profession for a long time, I do know that there's sometimes that it can be quite draining, not just physically but also emotionally as well, because you're dealing with patients, on their worst days. So there's always that emotional task that it takes to be a nurse. So I think I chose this profession or chose to be in this path specifically because I really do appreciate and really do want to help people and be there to help them through those difficult times. But also at the same time, I want to be able to advocate for them to get those resources and those benefits that they need to not go through these difficult times again. And also in that advocacy, I want to be able to advocate for myself as well to make sure that I'm able to be sustained in this profession because, going through just listening to a lot of stories I hear from nurses or anyone who works in a healthcare profession really, you hear about a lot of burnout, a lot of stress, a lot of work, a lot of stuff that just makes the field look very, very scary for me. And I'm just thinking back to my first year when I felt very undecisive. I was like, I don't know why I chose this profession, but I'm here. I think I like it. I think I don't, but I'm hearing so much about things and it's making me kind of, like, I'm not too sure if I want to do this. But then again, I moved into my second year and just being in the clinical environments really reinforced my feelings of being part of the nursing profession. And also I'm really eager and looking forward to the things that this generation does, especially my generation and the generations to come, because I believe that I see that we're very big advocates for the things that we want. We use all platforms. So we're using social media, TikToks, Instagram, all that stuff to make sure we get the information out there about the things that are happening in the nursing profession and how they can be changed, how it's detrimental to us. Even just bringing it back to my hometown right now in Canada, in Toronto, even here in Ontario, because we were having a lot of issues actually last year with COVID-19 and the pay, and also just like the way the union was able to fight for better pay was very, 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 very promising for me because I love to see things like that when people advocate for the problems that are going on in our little community around here. Because something I also used to talk about or talked about with one of my professor is how we have sort of seen the nurse profession as a calling, which is great. And I really do appreciate that we all see it as, a calling, a calling from above to help people, to be there for others. And when I get to the clinical environment, I do feel that calling for sure. But I also want us to not see the calling as a way as a setback, or a way to defend, not getting paid well, or a way to defend, being treated unequally, regardless to our peers, or a way to defend bullying in the environment as well, because there are a lot of issues that happen in the profession externally from the government, who might be defunding the profession, and internally within us, with bullying and nurses sort of eating their youngs. I hear that statement so much. And just everything that the panelists said today just made me really realize that this problem is not just homegrown, it's a problem that happens all around the world. There's so many places that are also experiencing these problems. And the only way and the best solution for us to get through this is to be able to advocate for ourselves. And in that advocacy, we also need to support ourselves, because it's great for me to say something and speak up about the issues. But if there's no one there to support me, I don't think I would be able to keep pushing, or keep trying to get to the places that I want to. So I do want to encourage everyone to, support as much as you can. Supporting in the sense that, could be practical for me or for students, could be like joining clubs, joining activities, joining organizations that advocate for nursing students. And then also at the same time, as you move forward, being in the profession, you also support your peers. If they're having a difficult time, you're there to support them, and you're also there to advocate for them if they're going through something that they need, that needs to be changed in the work environment, and also in the profession as a whole, outside with the government and everything. So I really do want us to support each other and be there for each other, because nursing field can be very tight knit. So in that tight knitness and just being together, it's always great to support each other with our work, and then advocate for the best things for ourselves, because we really do deserve the best. And we're nurses, so we're literally saving lives. So I really just want to use this little platform to really thank everyone for everything that they've said, and also just use this platform to advocate and just raise awareness for support as well. And last thing that I want to talk about, because a lot of panelists talked about this today, self-care is so very important. So we definitely also need to prioritize our self-care and be there for ourselves. And when we have challenges like bullying and issues in our workspace, they actually are very detrimental to our self-care. And it's also on us as professionals who are going into the field to analyze our behaviors at work, analyze the way we treat each other at work. So that's something I like to say. And also at the same time, I just want to speak on a little bit about what Mariyam said. Mariyam, Hussain, thank you so much for sharing the things about changing what was in the dictionary about nurses. And in the dictionary, I believe you said they had nurses being described as doctor helper, doctor server, or something like that. And it's so wrong, and it's so not correct, because these things reinforce stereotypes, they reinforce biases, that nurses are not supposed to be, in the leadership roles or in the professional roles and the PhD roles. They're not supposed to be there. They're only supposed to be serving and doing that stuff and be on the back side of things. And the doctors are supposed to be on the front side of things. And something that I actually noticed, and my professor brought this to my mind, or to my mind, yes, a couple of weeks ago, was how in one of our textbooks, Jarvis, I don't know if anyone's heard of the textbooks, but it's very popular here in Canada. A couple of years ago, actually, they had a statement in this very popular textbook that everyone has used before, where it said certain people from African descent typically have a higher pain tolerance than everyone else. And just see how that statement can be very detrimental, because then you see people who are from this descent in the clinical setting, and they might be complaining of pain, but in your mindset, because you've read this in a textbook, you already think like, oh, they're just saying it. They're just saying that because, they don't need the drugs, they don't need the medication. They're just saying that because, they just want to complain or something like that. So it's just, there are a lot of systemic issues that we have. And it's always great to point out those things, bring them up, those little things that we think, it's whatever, like something being in the dictionary. It's not that important. But then again, they really do reinforce those stereotypes, those negative biases that we have towards, the healthcare professions, especially nurses, who are part of minority communities, most especially. So like I said, everything that I've said today is just really reinforcing what everyone has said. And, I hope I have driven home the message of just advocacy to everyone. And I thank you all so much for this platform. I feel so inspired as a nursing student, to be honest. This was like the most inspiring event that I've had. I'm so glad to be here. So thank you so much. And I hope you all have a wonderful day.
Thank you, James. That was extremely meaningful. And this is something which is a message for many. Thank you. We welcome you, Srijana Katua. The floor is yours.
Namaste. Thank you. Thank you for providing this platform to share my experience in Nurses Voices speaker series. And like my journey as a nurse began in 2010 back in October in Nepal when I graduated from the Pokhara University as a BSc nurse. As our senior ma'am told that there are different kind of nursing, bachelor nursing in Nepal. So I was one of the BSc nursing. So after that, I started my first job in the emergency department in the Periphery Hospital, and then I proceeded to be a nursing instructor and teach a bachelor second year student for 1 year. And after that, I felt like I should add some more experience in my journey. So I joined a central level teaching hospital that is at the capital city of Nepal, and I worked there as a registered nurse in the medical intensive care unit, where I added a lot of experience regarding the critical care. And it is one of these central level hospital which has been providing critical care trainings, and the nurses there are working in the ICU are very much well trained and have lots of information and regarding the critical care, and lots of nurses are nowadays. It started back in 2014. It was like SARC first conference of critical care nurses in 2014. I had been a part of that, and from that onward, now lots of nurses are receiving training from the critical care nurses, and they are providing training as well. So they are getting better in these skills and development. So my new chapter of my life started when I came here in Canada in 2018. Until then, I worked in the medical intensive care unit. So here, after coming here in the Canada, so what happened, I started my process with NNES as a registration process, and as well as for CNO and CNO. So what I felt was there was a gap in according to the CNO and NNES, there was a gap between what we got taught in our back home and here. There is a curriculum unequal a curriculum, so that we have to go through this university. And that's how I got to get admitted in the New York University, and York University has provided a uniform provided a platform for the IENs with the vital competencies, and then education as well as clinical experiences for the students, so that IEN can integrate into the Canadian healthcare system very easily. Along with this transformation and and a journey, and being a student at York University, I also got my license as a RPN, registered practical nurse, in 2020, and I have been working in the long-term care during the pandemic at the peak time. And of course, nursing shortage was issue about that at the present globally, and even I faced at the same time over there. And so it was my a resilience or back home experience. It kept me moving, and then I kept on working. So here I would like to share some experiences regarding nursing in Nepal and here in Canada. So what in Nepal also, the nursing educations, everything and curriculum are taught in English language, as well as there are the textbooks which we refer to is in English. Despite that, what we faced here as IENs is we have a we have to meet an English language as a criteria, and that has held a lot of nurses over here from being a registered nurse very soon. So that is one of the thing. And so I feel like that there should be a uniform curriculum, and that matches all over the world, and and this may create less problem for the international educated nurses from whichever country they migrate over here in Canada as well as US or any other country. So another thing that I would like to say is like, how are the Nepali nurses? The Nepali nurses represent resilience, and they are kind and like very dedicated, as our ma'am told us. They are very dedicated, and they have worked in very hard situation with the short resources, limited resources, and during the pandemic, during the natural disaster, and everything like that. So and they are really hardworking. And so what I find is that, okay, what motivated us many nurses to migrate from our country to back to here is that we lack enough paid job. I mean, there is a low pay. There is more nurse patient ratio is not equilibrium. They are overloaded with the work, and of course, because of the brain drain, and as well as like because of the nursing migration, there is shortage facing at there is sort of nurse facing at the same time. So these are the things that are from in that I like to bring here. And what I find in Canada when I was started working, as well as when I'm a student, what I find is that here it is much more good support for the nursing resources. There is supportive working conditions, and there are advanced technology that has been used, and as well as for the patient, and there are lots of opportunities for nurses, and they have various things that they can specialized on, and as well as they have been up to date or by providing trainings on time. So which is less available in back home or Nepal. So and despite of this, and what I find is like in Nepal, the people are more like just like Canada, it is multicultural country, and like lots of communications, lots of the people are of different religion, and then communication, I mean having different languages. So that is the thing over there, and like here in Canada also, that is the same thing. And what I find difference is that in there we appreciated everyone which are from different cultural background. We acknowledge their family presence, and we listen to them more. But here what I find is like technically they are more efficient, and they are conveying messages to the interdisciplinary team very fast. But the thing that they lack is like still they don't provide enough attention to the patient as well as their families. So and like listen to them. And in this, what they miss is like they may miss some vital informations, because every family is different, every religion, or like every people are different in sharing their informations, and how they convey the informations, and the participation of the patient as well as the family members is every culturally different. So I think we should be more sensitive like in this matter over here in Canada. That is what I felt. And of course, that's like James told, like there is of course some racism, bullying, everything that is going that may be going on, and then we may face in one or another way. So that should be stopped, so that like every nurses whoever come here and work here, they get appreciated well, accepted well, and they can work in this Canadian healthcare, contribute to the Canadian healthcare system. And what I like to say is like here I am standing not as an individual nurse, like, but also like as a representative of lots of nurses from Nepal, because we in our York University only in my class 90% are almost of Nepal, from Nepal, the nurses who are studying. And they are who are going to be who have lots of experience, like 10 years, 15 years, 20 years of experience, not less than that. Like very few are very fresh. And this is the things like they are waiting to be RN and they are going to be contributing to the Canadian healthcare system. Of course, they may have difficulty in adjusting to the new trend or new system in the Canada than that was in back home, which was most of them paperwork. And now here is everything electronics. But what I want to voice is give them time. Not only that the Nepali nurses or every nurses, give them some time for adjustment. They have lots of experience. They can give it to you. If you accept them, if you acknowledge them, if you provide a good supportive environment. That's what I mean to share through this platform. Thank you.
Thank you, Shana. That was extremely meaningful and very touching. You spoke on behalf of multiple nurses, and that's really appreciated.
Thank you.
As we come to the end of this session today, I would like to take this opportunity to thank Dr. Diva Marie Peck and Francisco for the additional time period which we have received. Fortunately for us, if you look at the chat box, we don't have questions, but we have hundreds of notes of support, of understanding, of a feeling which one nurse has towards another. This basically tells us that nurses from Asian countries are extremely united in their thoughts. They feel the same. They are very close to nursing as a profession. And thank you, Nightingale Initiative for Health and York University for giving us the opportunity to allow the voices of nurses from these institutes, these countries to be heard by everyone globally. We had fabulous representations from their own countries, Bangladesh, Nepal, Maldives, Pakistan. We had our York representations. We had India representations. What more can we ask? A big thank you for making this possible. Thank you, Deep.
Thank you,
Greetings,
everyone.
everyone. We love to end these sessions with the Nightingale Declaration for a Healthy World, now available in 13 languages. And we're hopeful that this declaration can be available in the languages represented by the people in Southeast Asia. Next slide, please. Next. We, the nurses and concerned citizens of the global community, hereby dedicate ourselves to achieve a healthy world. We declare our willingness to unite in programs of action, to share information and solutions, and to improve health conditions for all humanity, locally, nationally, and globally. We further resolve to adopt personal practices and to implement public policies in our communities and nations, making this goal achievable and even inevitable. Beginning today in our own lives, in the life of our nations. And in the world at large. Florence Nightingale, what would have she said to us? What did she say to us? We are only on the threshold of nursing in the future, which I shall not see, for I am old. May a better way be opened. May we hope that when we are all dead and gone, leaders will arise who have been personally experienced in the hard practical work, the difficulties and the joys of organizing nursing reforms, and who will lead far beyond anything we have done. Please join us with your voice. Thank you again so much, with deep, deep gratitude and respect to all of you who have presented and who have listened. We hope that this presentation and our future plans will serve bringing the health of the world to a better place through nurses' voices. Thank you again so much.
Thank you, Diva. That was
You're
phenomenal.
welcome.
Oh, it was fabulous. And thank you, Francisco, for letting us extend this. It was just absolutely rich beyond rich. I don't have enough words to say. I'm joyful.
So
Of course, yeah, thank you. I just want to also echo my thanks to everybody for taking the time to be here and present. Thank you, of course, Phalakshi, for moderating and for helping organize the whole session. Thank you as well to Diva and Barbie for all of your help throughout the entire series. And yes, again, thank you to everyone for those great presentations. And thank you, of course, to everyone in our audience for taking the time to be here and supporting the series and the session. And I did just want to quickly update everybody. There has been a slight change in our schedule for the series. So there will be no longer a session in April. Our next session, session 6, will be on May 7th. And our session that was scheduled for April has been moved to May 21st. And the last session will now be on June 11th. So just a quick update to everyone in the audience. We are still scheduled for 8 sessions, but next month has been postponed a little bit. So with that, thank you again to everybody, and I hope everybody has a great day.
Oh, well.
Thank you.
thank you.